Awesome.
Somebody might need to send something to Jim so he can get on.
Everybody on mute.
We here? Can't hear.
I am the Blacksmith Cop, and I'm here with my man Eddie Drake of the YNOTTOU Foundation. And we just want to talk to you. Somebody's sister, a brother, father, a mother, a wife or a husband, a nephew, a cousin. They're looking for a little bit of love, hey. Somebody show them some love, hey. Why not you? Why not? Hey. Why not? Why not? Why not you? Why not? Why not? Why not you? This is the Why Not crew, and all we asking is why not you? Come with the Why Not you? And on this occasion, give one donation, and you may not receive a standing ovation. Nah, your reward is so much better than that. No matter the black can replace the feeling of giving a second chance in life. The only second chance is price is your commitment. Man, it's your compassion. You can come and give it, there's no special form of fashion. Giving a child another chance to smile, just imagine. Or you can try not to. But if you see it, I'm asking why not? Somebody's sister, a brother, father, a mother, a wife or a husband, a nephew, a cousin. They're looking for a little bit of love, hey. Somebody show them some love, hey. Why not you? Why not? Hey. Why not? Why not? Why not you? Why not? Why not? Why not you? I am the Blacksmith Cop, and I'm here with my man Eddie Drake of the Why Not Foundation. And we just want to talk to you. Somebody's sister, a brother, father, a mother, a wife or a husband, a nephew, a cousin. They're looking for a little bit of love, hey. Somebody show them some love, hey. Why not you? Why not? Why not? Why not? Why not you? Why not? Why not? Why not? This is Why Not Crew, and all we asking is why not you?
All right, so Lily just informed me that we are not live yet. She's in the process of setting that up right now. So when she goes live, she'll the slideshow, and then we'll be ready to go.
No, awesome. Thank you for that, Philip. My mind was sitting here going, like,
Oh no, you good? Yeah, no problem.
no.
I had to call her because one of the just was in the attendee section, so I needed to get her to switch over. So
Yep.
and
Sorry.
she informed me then. So
It's just now loaded.
Awesome.
Philip, you sounded a little bit better at the end, but at the beginning you was dragging just a little bit with the internet. I'm not sure you're lagging a little bit or something.
yeah, I don't. It's probably because I'm doing mine through the actual browser. I hadn't set up the Zoom on this laptop yet, so through the app. So that could be it.
You sound a lot better now.
Yeah,
Just at the beginning, you kind of had a robot effect.
Oh yeah, it was probably kind of just getting everything together, or what y'all like say, because I just literally just got this yesterday. So
All right, you sounding good. You sounding sharp, my friend.
cool. Appreciate you. Thank you.
Sharp too. I don't want to hug you or anything, but looking sharp.
I don't need no hugs. I'm okay. Thank you though. I appreciate you.
Hey, Tafar.
Yeah. Yes.
Lily, in the attendee section, Edward's wife, can you switch it to the panelist section, please?
All right.
Hey, Cook, just make that intro short. I won't say as much. I'll just do a quick introduction just to save time since we're behind. But that's cool. I'll just be very brief with that intro.
Are we ready? Are you gonna go through that again, or?
Can you
Is
all
she
see
gonna
my
play it?
screen?
Yes.
Yes,
Yeah.
sir.
All right, here we go.
I am the Blacksmith Cop, and I'm here with my man Eddie Drake of the Why Not Foundation. And we just want to talk to you. Somebody's sister, a brother, father, a mother, a wife or a husband, a nephew, a cousin. They're looking for a little bit of love, hey. Somebody show them some love, hey. Why not you? Why not? Why not? Why not? Why not you? Why not? Why not? Why not? This is the Why Not Crew, and all we asking is why not you? Come with the Why Not You. And on this occasion, give one donation, and now you may not receive a standing ovation. Nah, your reward is so much better than that. No medal or plaque can replace the feeling of giving a second chance in life. The only second chance's price is your commitment. Man, it's your compassion. You can come and give it, there's no special form of fashion. Giving a child another chance to smile, just imagine. Or you can try not to. But if you see it, I'm asking why not?
Somebody's sister, a brother, father, a mother, a wife or a husband, a nephew, a cousin. They're looking for a little bit of love, hey. Somebody show them some love, hey. Why not you?
Why not?
Hey.
Why not? Why not?
Why not you?
Why not?
Yeah.
Why not?
Why not you?
Why not? Why not? Why not?
Why not you? Why not you? Why not you?
Why not? Why not? Why not?
Why not you?
Why not? Why not? Why not? Why not? Why not?
Good evening, ladies and gentlemen, and welcome to the 2021 Why Not Foundation Youth and Disease Prevention and Wellness Symposium. I am your host, Tafaro Cook. I'm a two-time kidney transplant recipient who thrived and survived dialysis for over a decade. I'm the founder of Kidney Care Coaches. We coach people with stage 3 to 5 kidney disease for better outcomes. I'm also the author of the 10 Dialysis Commandments. I have been with the Y Not Foundation since '08. We have worked with hundreds of pediatric transplant kids throughout the country in hospitals, transplant camps, and wellness events. This work is dear to my heart. Without further ado, I'd like to introduce you to the founder and CEO of the Y Not Foundation, Mr. Edward Drake.
Awesome, awesome, awesome. Thank you, Tafaro. Appreciate you. And thank you all, everyone who's tuning in and who will see it at a later date. First and foremost, I just want to thank our supporters, those behind us who helped make this event even possible. Without you all, like I said, none of this, none of our life-impacting efforts across the country would ever be able to come to fruition. So definitely give you all a round of applause, starting with CareDX, our partner in transplant care, Kidney Care Coaches, What's the Move Media Group, A Second Chance Podcast, and Why Not Me Enterprises. I would like to secondly thank all my teammates, the hundreds of individuals who've come and worked with us over the years, from starting in college back in 2006, when a young student athlete like myself got sick with kidney failure and said, why me? Until now, almost 15 years, 16 years later, where now this organization that started in a dialysis center has now impacted thousands of lives across the country and counting. So definitely I would like to give a shout out to everyone who helped lay a brick and help assist a family or give some school supplies or visit a kid in a hospital. This would not be possible without you all. We've spent hours these last few months trying to make this event possible. And just a few minutes ago, my heart almost was pumping on my chest. I almost needed a heart transplant. I almost needed to talk to the cardiologist who will speak today, as things were just kind of in chaos. But like anything in life, things come together. You just gotta, stick it out through the rain, and eventually the storm will stop. As you can see, now we're on the air live and ready to have a good time. So enough about me. This is about you. This is about helping those youth and those individuals not become a Edward Drake or a Mr. Tafaro Cook or a Philip Jones or a Miss Sharon or Jonathan or Jim Myers and so on and so forth, and all the other kids who we work with across the country. We want to help prevent you all from getting to the point where we got to take 20 pills a day. I know I speak for myself and have to, dealing with stuff like skin cancers, which is why we got a dermatologist on here, and have to go get our heart checked, which is why we got cardiologists and so on and so forth. So without further ado, I want to thank you all, thank all the panelists who will speak and all the discussion leaders for taking their time, and let's get this thing started. Let's go. Why not enjoy this symposium? Take it over, Mr. Tafaro Cook.
Thank you, Edward. Such kind words. It was really nice to hear you say those wonderful things. So coming up with the panelists, we want to introduce the panelists just for a moment. Can you hear me? I'm sorry, I had a phone call. We want to tell you about the panelists and our Why Not panelists. We'll start with a couple questions, but we'll start with Erica Nicolet. Hi, Erica.
Hi, Tafaro.
Good seeing you. You look wonderful today.
Okay.
Erica, tell us a little something about yourself.
Well, I'm a licensed practicing attorney. I worked in human rights for the UN in Malawi and Africa with child marriage. And all of my passion for social justice led me to start a production company called Pavel Films. And that's what led me to organ donation. My latest feature film is about organ donation. I've been following 3 individuals for the past 10 years. And recently I started a short series on celebrating change makers, such as yourselves. Several of them are here who are out there doing the boots on the ground work. So I wanted to have a platform to celebrate them and also celebrate you all, so we can have a place to also show your accolades and what you're doing behind the scenes for this very, very important work. So that, in a nutshell, that's what I'm doing. I'm out here just trying to make a difference like y'all.
Wonderful. That's beautiful. Great. Congratulations on that work. All right. Sharon Rouse, that question goes for you also. Can you tell us a little bit about yourself?
Absolutely. Good evening, everyone, or wherever you are in the world, depending on your time zone. But I'm the Eastern side, so it is evening here. But I'm so delighted to be here and to be a panelist. I really admire the work that you do. My name is Sharon Rouse, as Mr. Cook mentioned, and I am a former hemodialysis and peritoneal dialysis warrior, now kidney transplant recipient for the past 7 years. I matriculated in the education world up until this past June, where I resigned from my job. So I spent the last 20 years as teacher, counselor, coordinator, you name it. I've probably done it in education, and just recently resigned from my job. 2 years ago, I founded Kindness for Kidneys International Incorporated. And we do a lot of work here in the Washington, D.C. metropolitan area with a focus on educating, encouraging, and empowering kidney warriors and their families. Thank you once again.
Wonderful work, man. That's awesome. That's great to hear, Sharon. That's wonderful. Philip, that question goes to you too. Can you tell us a little bit about yourself, Philip?
Thank you, Tafaro. I appreciate that. Definitely. I am a transplant. I had my transplant at UCLA. Recently in March, started a second chance with some individuals who've been on my show actually here today. I've pretty much been involved with Why Not for the past 2 years. Mr. Drake to be able to touch the life of children all over the country and potentially the world, and to be able to make a difference. So appreciate Why Not 100%, and for being, definitely include me in the family. So
Good job. Your sound wasn't the best, but Second Chance, I know you do that Second Chance podcast, and I know you transplant with from UCLA. I just wanted to give them a little bit of information because I know a little bit about you and all the wonderful stuff that you do, but I don't know if everybody else can hear you that well. But good job, Philip. That's wonderful. Jonathan, that question goes out to you, Jonathan. Can you tell us a little bit about yourself as well?
Absolutely. It's an honor to be a part of this symposium. So thank you for inviting me. I'm Jonathan Traylor, and July 8th of 2019, I experienced emergency kidney failure. And based upon that, I started a podcast called Hope with Jonathan. We share warrior stories in need of a living donor. And we definitely believe in the power of sharing your personal journey, getting it out there to advocate for a living donor. So definitely enjoy. It's an honor to be a part, an honor to share warriors that are in need. And there's definitely a great need for a platform out there for that. And so that's what we do with Hope with Jonathan. Thanks again.
Awesome, Jonathan. That's wonderful, man. Like I said, I always heard good stuff about you from Philip and everything. And I was like, man, I can't wait to meet this cat, man. And glad you're doing well. Glad you're doing great work, man. I appreciate that. Uncle Jim, that's who we call. We call Jim Myers Uncle Jim. He's Eddie calls me the old man, but I think we got somebody a little bit older. Jim, can you tell us a little bit about yourself, please? Jim is not on the call. Okay, all right, we'll move on then. Okay, we apologize about that. So I have another question. We'll start with Erica again. Erica, tell us, what is it like living with chronic disease? And just let me ask you that. How's it like? What was it like living with that?
Well, that question might be for someone else. I've never had kidney disease, but I had an uncle. What
Okay,
interests me
family
in
member also.
I had an uncle that had 2 failed transplants, and that's what launched me into the search and the discovery about the topic in my community. So I watched my uncle suffer through it. So I don't know firsthand, but I do know what it feels like to be a family member of someone suffering through that.
Right. Yeah, yeah. Living with somebody is pretty, being that caregiver and everything. That's pretty traumatic also too, to watch somebody like you love go through that. Sharon, tell us about how you lived with kidney disease and what you had to overcome.
Sure. So for someone like me that didn't have a family history of it, it kind of took me by storm. No one in my family has had kidney disease, high blood pressure, diabetes, any of those things. And so when mine came about, it really almost knocked me off my feet. And so I think for me, what I've learned is that I enjoy every moment and I don't take life for granted. Every breath to me is a gift. When you're knocked off your feet with something like that, with a serious health condition, it really makes you change your perspective on life. And so I don't focus on the bad moments. I may have moments, but my focus is always on, okay, I got to get better to get, to continue to enjoy the life that I have. And so for me, and I always encourage people, if you focus on the bad things that are happening, that's where you're going to find yourself in that space. Right. But the more you focus on the good things that, hey, I'm able to get out the bed this morning, that might be a huge victory. Right. Whatever that victory is for you that day, focusing on those small moments to me helps you get through chronic illnesses. I mean, we're going to have bumps in the road. There are going to be times where you're tired, where you just don't have the energy to go on, or you're depressed, you don't feel like going on. But celebrating those small moments helps you get to the next moment. And then, days do get better. And so that's how I manage my illness. I think it also helps, and it translates down to my body as well, because my mind, I'm constantly renewing my mind. And so I think that's important as well.
Awesome. That's great to hear. Like you said, going through what you went through, I have experienced that also. So just those little small moments, just getting out the bed on 2 feet and standing up is a good thing sometimes. People, don't take those things for granted. Philip, tell us about living with chronic kidney disease and the things you have to go through.
It's a fight. I think that a lot of us that go through this every day kind of know already. The one thing I always say is that one of the most important things outside of a donor is your support family. So for me, I have a great support family. My immediate family, my YNOTTOU Transplant community family past, some obstacles that I may have. But you know, I'm not gonna say it makes it easy. It just makes it easier. You know, and so you know, I'm definitely grateful for them.
That's great to hear, man. Like you said, your support system is big and everything, and sometimes we have to really, really rely on that support system, even though we try to stay strong sometimes. But the support system knows you, and they know when you're down, and they know when you need assistance, and that's great to hear, man. Glad you're staying strong, brother, for sure. Jonathan, that question goes out to you. How was it living? You know, you said you had emergency transplant immediately, emergency kidney failure. Well, how was that? Because that was just, you know, right off the bat like that for you.
Oh, Tifro, it was life altering, head spinning, you know. I went to the hospital with a lot of different symptoms, thought I was fighting the flu. Ultimately woke up in the bed, you know, trying to get out of the bed. I fell in the floor after about 3 or 4 days in the bed. My wife kept begging me to go to the hospital, and then ultimately ended up in the emergency room with my heart palpitating out of my chest, my lungs filling up with fluid. I felt like I had ran a marathon, literally. And ultimately, my local hospital here didn't have a dialysis machine, so I had to be stat flighted in a helicopter. And I woke up 3 days later in the ICU. You know, unbeknownst to me, I was already on dialysis, hemodialysis, you know, for 3 days, and they had taken off like 30 pounds of fluid. And so you can imagine it was a scene out of your favorite TV show, really. But these were the effects of chronic, type 2 diabetes and hypertension. And for many years, they were uncontrolled. And it was definitely, I was a classic case of white coat syndrome. Just did not like going to the doctors, wasn't staying on top of my health care. These were the effects of, poor diet choices and lack of exercise, type 2 diabetes, and hypertension. So it was definitely, kidney disease was my major wake-up call, and it totally altered my life, Tifro. Thankfully, through the prayers and strength of family and support, I was able to make it through. And it's just a blessing today to be able to tell my story.
That's awesome. Just like you said, I go back to what Sharon said. You know, getting out of bed, people take that for granted, and you know firsthand, it was a challenge just getting out of bed. I've been through those days like that, and just standing up. Sometimes you just have to raise your hands and like victory, like, man, I'm here. People don't know how good it feels just to be here, you know, and then, you know, doing your work on your purpose. That's great. We have one more question for everybody, and this question is going back to Erica. It's Erica, can you share a final word of encouragement to patients and family members and their medical team?
Words of encouragement. For me, when I think about the lives that I followed for the last 10 years and seeing how they've interacted with their caregivers and their providers, the word of encouragement is don't get up, stay focused, and always educate yourself. Be your number one advocate, and always know the most about your illness and yourself, because you should be the number one person who knows the most about yourself. So don't give up. Don't take everything for face value, and make sure that you feel confident when you're in the room with providers, when you're in the room with anyone. Make sure that you know enough about your illness that you can have a word and you can have an opinion, or at least know enough to ask the right questions. So don't give up, take your time, educate yourself, and just be patient with yourself and your providers, and know that it's a collaboration, and work in a collaborative form, and keep your energy and vibrations high, and everything will work out.
That's awesome. Like you said, you have to be your number one advocate. And that's what I preach all the time. And even when I talk to the youngsters, you know, hey, guys, you got to understand and learn a little bit more about what's going on with you. Like you said, Erica, you hit it on the head with that, because that's where, you know, you don't want to go into a fight without you having your weapon, and your weapon is your knowledge, and that's what you have to have. And I appreciate you saying that. Also, this goes out to Sharon right here. Sharon, the same question, but I'll ask you, share a final word of encouragement to patients, family members, and their medical team.
Sure. And so Erica kind of took the words right out of my mouth. But at the end of the day, it is a partnership, and it is about each person having a voice to come to a collective good for the best interest of the patient. And so if you back down and you're not vocal about how you feel, maybe some things that could be changed or worked through, it's very difficult even for the provider to help you. So it's kind of, everyone has to kind of come to the table with their particular pieces so that when the village comes together, we see results and we see the impact of that. I would also say to patients that a diagnosis of kidney disease is not a death sentence. And sometimes when patients get that diagnosis, it's like it's the end of the world. And I completely understand, because there's so many emotions that come with being diagnosed and then even having to go on dialysis. I do understand that. But my word of encouragement is that is a chapter in your book, and it's not the whole story. And so don't stop at that chapter. You have to keep moving forward to see how the story plays out. And so that would be my word of encouragement. One, it takes a village. And two, this is a chapter in your story. So don't give up. You have to wait to get to the end, to the good part.
Right. It's just a chapter. Like you said, don't give up, because, it will come to an end, but you have to fight. And like Sharon said, that is just a chapter, and she's exactly right about that. And sometimes the chapters aren't that good, but, thank you for that. That was great words. Philip, we'll go back to you with that same question. Share an encouraging word to patients, family members, and their medical team.
I'm actually kind of piggyback off Sharon a little bit. Find people that can encourage you to keep fighting. Don't try to do this on your own. I've been going through this since I was 4 years old. I'm 31 now. It's not something that we can do by ourselves. We have to find people that can back us and push us through our situation. This is a fighting situation that doesn't take just one person. It takes an army. Like she said, it takes a village. So find you a village that's going to help you and be there for you to get you through this.
Awesome. That's awesome, man. I feel you, brother. You know what you're talking about with that, man. I've seen you help hundreds of people with what you do and everything. That's wonderful. Jonathan, this question goes out to you too. Can you give us an encouraging word to patients, family members, and their medical team?
Absolutely. Never give up on yourself, and always hang on to hope. There's always hope. Even though it seems like things may, look dark and dim, hang on to hope. Surround yourself with positivity, positive people, like what Philip was saying, Sharon, Erica. It's great advice what everyone shared, but also surround yourself with your support. When you battle a chronic illness like kidney disease, support is so crucial, whether that's through family, friends, or community. Wherever you can find support and whatever you feel comfortable with, definitely reach out and lean upon that support when you need them. You're going to have tough days. You're going to have days that are really a battle, but that's where your support's going to come in and help you through it.
Thank you, Jonathan. Firsthand, man, and that's great words of encouragement for everybody. That was wonderful. All right, thank you, panelists. We really, really appreciate that. Moving on right now. Lily, do we have a commercial right now, or do we transition right into?
Yes, we have a commercial. We have a commercial with CareDx.
All right, CareDx is coming up. Thank you, everybody. So just take a break, and we'll be with the CareDx.
Hi, yes. Well, thank you. That was a short break, but we're on a time crunch. So now I would like to introduce Miss Yolanda Wilson, if you're on, from our partner in Transplant Care, CareDx. I believe she's on. Is she on? Okay. Let's see. Okay.
I don't see her.
Okay, she may not be on, so definitely you can proceed into the next panel. We'll add her on.
Okay, we'll go into the next panel then. All right. Okay, so right here, we are starting the modern era of disease and awareness panel. We have on this panel right here, we have Erica and we have Edward on this panel, and we'll let them take it away. Go ahead, Erica and Edward.
Thank you, everyone, for having me again. And let's dive right in. So as Tafaro mentioned, this is the Modern Era of Disease Prevention panel. And let's just start with our panelists, and we can maybe have them say a little bit about themselves. Dr. Ettinger, he's our nephrologist. If you'd like to come on and say a few words about yourself and your background.
Needed to unmute myself. Yeah, I'm Bob Ettinger. I'm a transplant physician at UCLA. I was head of the Division of Pediatric Nephrology for more years than I like to count. My main claim to fame is I was Philip Jones's doctor. So that has made me very famous since he's done so very well. And we're all thrilled at how well he is doing. He's a good example of how one takes care of themselves and utilizes all of the facilities that are there to make him well, and he has made himself awfully well. So that's the most important. Everything else is a side of, a side thing.
No. Awesome.
Thank you very much. Edward, do you want to take it away, or you want me to continue introducing the panelists, sir?
Continue.
And our next panelist will be our cardiologist, Dr. Geft. If you'd like to say a few words about yourself.
Sure. Thank you so much for having. Can you hear me okay? Okay, good.
Yes.
First of all, this is my first introduction to Why Not. I really thank you for having me, and I can already see what an incredible organization this is, how much you do for so many patients. And it's so important to have organizations like this. So thank you for having me. I'm here from the Los Angeles area. I grew up here. I'm a cardiologist at Cedars-Sinai. More specifically, though, I am part of the heart transplant team. And as we'll talk about shortly, the heart and the kidneys are very intricately linked. And many of our heart transplant recipients are actually also combined heart and kidney transplant recipients. And because of that connection, I've had the pleasure and privilege of working so closely with the kidney transplant team. And they send a lot of patients, pre-kidney transplant patients with end-stage renal disease to me to evaluate for kidney transplant, make sure that their heart is good enough condition to go ahead with it. And for that reason, I've myself learned a lot and had such an incredible privilege to meet so many patients now who are on dialysis, going through the very things that many of the panelists just talked about. And I can see what it means to have support when they come with their families or friends or have a donor or get transplanted, and then what it means to live with that for the rest of your life. So it really is incredible work that you're doing, and I'm really glad to be here.
Thank you kindly, Dr. Geff. We really appreciate you being here. Next, we have Dr. Michael Narkowitz. Welcome. Please tell us a bit about yourself.
Thanks very much. So I'm Mike Narkowitz. I'm a pediatric transplant hepatologist. Translating it means I do liver transplant work. I've done it much like Bob since the late 80s. So I've seen the evolution. I too, like Dr. Geff, am new to the Why Not Foundation. I'm representing the American Liver Foundation. You put out a call for help, and I'm the chair of the Medical Advisory Committee for the American Liver Foundation. So I'm honored to be here and hope that I can help with education.
Thank you kindly. So without further ado, let's get started. Let's start with you, Dr. Ettinger. If you could please unmute yourself, we can get started with you. So The first things, we all introduced ourselves in the beginning, and some of the panelists discussed their issues with kidney disease. What would you say? So this is a two-part question. What would you say are the main issues of patients with kidney disease? And the second part of that question is, how can we prevent those challenges?
Okay, now I'm talking here about the pre-transplant situation. My practice is sort of split between pre-transplant patients and post-transplant patients. So what are the issues that are important with pre-transplant patients, but also apply to post-transplant patients? Because you can pick this up both ways. Number one is blood pressure. It's critically important to control the blood pressure because that not only tears down the kidney, but it tears up the heart and other areas. You can get strokes, you can have massive problems. So number one, blood pressure. How do you deal with blood pressure? Antihypertensive medications, monitoring blood pressure, monitoring diet, holding down the salt, for example. Number two, something that most people don't think about very much is bone health. And patients with chronic kidney disease have definitely what we call kidney osteodystrophy, kidney-related bone disease. Again, pre-transplant and post-transplant occurs more as your kidney is doing badly, and can lead to fractures, can lead to deformities and disabilities. What to do, and there are medications that one can take, and also, again, changing diet to lower the phosphorus in the diet in particular. Now, you're getting, I hope, sort of a sense of where we're going with this is being adherent with the medications and being adherent with the diet. It's easy to say, not necessarily easy to do. Next, of course, the issue is heart health. One needs to follow with cardiologists because the kidneys and problems with the kidneys can lead to the problems with the heart. And I think we're going to have my colleague from Cedars-Sinai is going to take more about that. So the best ways to deal with staying well are living with the medications, living with the diet. One other thing that I want to say, and I'll say this again a little bit later, watch what you see in the internet. Watch what is purported to be being a cure or whatever. I went on the internet in preparation for this and found out that some folks on the internet were saying that certain fruits were helpful, certain, all of these different things were helpful. And you've got to take that all with a grain of salt. Anybody can go on the internet and can say anything on the internet. Unfortunately, we can treat various types of kidney disease and frequently successfully, but there is no silver bullet for being able to reverse kidney disease. And that's an important thing that people have to understand. Lean on your doctors, lean on your significant others. They will help you, they'll help keep you well. But understand the waterfront with this. And I think that was said very significantly, be your own best advocate.
Wow, that's very informative. Like I said, we work with a lot of kids and a lot of them participate in sports. And I just have a quick follow-up question on that. Is there a way, or kids are they still able to play sports?
Funny you should ask me that. This is a softball question because Philip is one of my success stories with regard to sports. I'm a big advocate of sports. I played as a kid, I played basketball. I coach basketball, I coach soccer. I am a big believer that kids should play as many sports as I can. I've had kids that have played D1 college basketball. I've had kids there have been kids that I've played football. In fact, I tell the kids that play football, the only thing I don't want them to be is a wide receiver, because I don't want them going up and exposing their kidney. Other than that, they can do anything they want.
Wow.
No, physical activity, sports, we are really gung-ho for that. Philip went to the Transplant Olympics. We at UCLA tried to help him to go. So we're very proud of Philip and very much proponents of sports.
Wow, that's awesome. I wish you were my doctor. I still got some eligibility left, so I may have to come see you so I can play sports. But thank you.
Well, let me work on your jump shot, and we'll see.
Yeah, that's another question. So, but thank you, Doc. All right, I have a question, and please correct me if I mispronounce your name, Mr. Dr. Dale Geft. Is that correct? Awesome. Ooh, I got lucky. Okay. When is it apparent that someone needs to see a cardiologist? And is there a way to slow down the progression of heart disease?
All right, thanks for that question. Before I talk about when it's clearly apparent that someone needs to see a cardiologist, I'd much rather talk about how to avoid needing to see a cardiologist. I mean, certainly there's some things we can't control. Some things are going to happen no matter what we do. But the name of the game and the title of this conference in a way is really prevention. A lot of the underlying diseases that lead to heart failure, kidney failure, even liver failure, a lot of them are overlapping. Things like high blood pressure, things like diabetes. Whenever I see kidney patients and I try to explain to them why they're in my office, if they're undergoing evaluation for a kidney transplant, why are they in my office if they've never had a heart problem before? To explain to them, it's the same things that could destroy your kidney. It's a process going throughout your whole body for many, many years. And these are also, Dr. Edinger spoke about it, controlling blood pressure, knowing about your blood pressure, but a lot of these things are silent. We don't know about them until damage is done. And that's what's very scary about it, is if you're not aware of it, if you're not your own advocate, if you're not thinking about it or have a doctor or family member to tell you about it, you may find out when it's too late. Mm-hmm. But prevention is really the name of the game. And by that, I mean a number of things. First and foremost is lifestyle, promoting a healthy lifestyle. What I mean by that is even from a very young age, because all these diseases, they start young, is exercise and diet. I know it's cliche and you've probably heard your parents say it a million times, but truly eating properly from a young age doesn't mean you can't have foods you also like and have cheat every once in a while, but focusing on vegetables, whole grains, nuts, a diet that's more rich in fish rather than fried and fatty foods. It's really essential that people start to do that even at a young age. The processes of atherosclerosis, for example, where you build up plaque and blockage in your arteries, that can happen in your heart or anywhere in your body. That starts at a younger age. You don't usually see people having heart attacks at younger age, but it starts at younger ages. And so the prevention starts when you're younger. In addition to that is exercise. I think they say about the average US adult probably spends over 7 hours a day sedentary, where they're literally just sitting around doing nothing. And it's extremely important to have a routine of exercise. As you get older, you need to enforce it because you get busy with life. When you're younger, hopefully you have the opportunity to do it with school and sports, but it's really important to have routine exercise in your daily life. Other things that are crucial are to avoid certain toxicities. For example, smoking, alcohol. These things are still very common. They are still silent killers for many years until ultimately they can lead to organ dysfunction. It's extremely, extremely important that we really, really emphasize to youth and adults the importance of preventative measures so you don't have to end up coming to see a cardiologist. And nowadays, in cardiology, it's very exciting because we have many very exciting medicines. We have incredible technology to replace valves, put in stents, open blockages, heart transplants. That's wonderful. But I'd much rather you never need any of that and start preventing early and not require anyone to fix a problem, but rather prevent the problem. And we can talk more in detail if anyone has questions later in terms of what medications we do use to also help prevent progression of disease, because that was part of the question as well. Preventing and trying to, not just preventing, sorry, but slowing the progression of disease. Aside from controlling of the risk factors that we talked about, there are also medications we use. Blood pressure medication in addition to lifestyle to bring down your blood pressure, like a low salt diet, exercise, weight loss, if you're overweight. But medications to control blood pressure, extremely important. Number two, statin medications, things you've heard of, things like Lipitor, Crestor, very common and popular medications. Crucial to slow the progression of people that have high risk factors, like diabetics, people who have already known cardiac disease. Very important to get cholesterol under control, to control that risk factor. And finally, diabetes is the other major one. And we have medications, of course, for that, in addition to diet and exercise. Medications that now are even coming out, and we're discovering these are good medications to prevent heart disease, even in non-diabetics. We've actually discovered recently in the last few years some diabetic medications that we now use in non-diabetics simply to treat heart failure, for example. To answer the other question, the other part of the question was, well, when is it apparent to see a cardiologist? Well, unfortunately, it's certainly often the case that one does need to see a cardiologist. There are times when it's clearly apparent because of symptoms. People are developing symptoms, they shouldn't ignore it. And oftentimes people ignore symptoms for a long time before they do something about it. But symptoms that really have to be focused on and paid attention to, chest discomfort, pain, pressure, tightness. It's not always chest pain. It's sometimes just a discomfort, particularly when you're exercising or exerting yourself. Shortness of breath, a very common symptom that can be caused by a million different things, but not to take that lightly. When kidney patients get overloaded with fluid, if they haven't had enough dialysis or haven't started dialysis, they can be very short of breath. That could be from a heart issue, could be from a kidney issue, or the two of them together. Palpitations, particularly if people feel them quite often, or if they're associated with lightheadedness. Fainting, people have had fainting episodes. These are also other reasons to investigate with a cardiologist. But oftentimes without symptoms, there are reasons that a doctor may refer you to a cardiologist, like your primary doctor, for example. Physical exam, he or she may notice on physical exam that you have an interesting murmur in your heart. You may have swelling. You may have certain signs on exam that indicate you may have a heart issue. If you have very difficult to control blood pressure, you may need more than one medication. You may need more of an expertise in treating blood pressure. Lights just went up. In addition, there are a lot of tests that get done out in the community. EKGs, chest x-rays. There are abnormalities on these imaging tests that often leads to sending people to a cardiologist. And then we can investigate further with additional imaging or whatever test is needed. And the final thing I'll just mention is not related to symptoms or exam findings, but family history is another important thing to consider. One of the panelists mentioned that she never had any family history of any of those risk factors or kidney disease, and yet it happened. But people who do have a family history should really be aware of that, and that factors in greatly when considering someone's overall risk and when they should see a cardiologist sooner, when we need to be more aggressive about controlling cholesterol, when we may need to be a little more aggressive about starting them on certain medications. So those are all really important factors to know, when to see a cardiologist.
Oh, awesome. Very informative information. Thank you. I feel like I can go teach a class now, but thank you. Take it over, Erica.
Yes, thank you, Dr. Geff. I wanted to ask you because today my mother, she just came back from her annual checkup and I asked her about cholesterol and her numbers. And she mentioned, oh no, they only check cholesterol every 2 years now. So my question to you is that something the insurance companies have done, or should we be having our cholesterol checked annually? And is it possible that your cholesterol can't, deteriorate or get so poor over the course of 2 years that you would not need to have it checked? So I'm curious, should we be asking for that blood work to be done annually, or should we be allowing, this 2-year gap between our cholesterol being checked?
Okay, that's a great question. But then also, first of all, I'm not sure certain insurance companies may have changed their policies, but in general, it really depends on a few things. Depends on a person's age and underlying risk factors and comorbidities. Young people, for example, let's say in their 20s, 30s, if you haven't had a strong family history of it, or you've had a normal cholesterol in the past, you do not need to check it every 1 year or 2 years. Sometimes if they're young enough, we can even wait 4 to 5 years. However, once somebody's already an adult, once somebody has comorbidities or has a history of high cholesterol is being treated for it, then I'm always checking it at least once a year. At least once a year. Once somebody's on medication for it and it's been very well controlled, if they don't make any significant changes in their lifestyle, diet, or exercise tolerance, if they don't change their weight too much, then chances are the cholesterol is not going to fluctuate so much that you have to check it any more frequently than once a year. But for anyone, any adult, certainly 50 or above, especially if they have other risk factors, or if they have high cholesterol, whether they're being treated yet or not, I would definitely check it at least once a year. I don't wait 2 years.
Okay, thank you. I think that's important to know. I was just stunned when she told me that. So that's great. So depending on your risk factors, please get your cholesterol checked every year. So thank you, Dr. Geff. So moving on to Dr. Narkowitz. And I have a question here, but I loved what Dr. Geff did. He began with prevention. The question I have here for you is, what are the leading signs of liver disease? But what I'd like to ask you is, from a prevention standpoint, what are some of the things we can do to keep our liver healthy? And then we can go into what are some of the leading signs of liver disease and ways that people can slow the progression. I know I drink lemon water. I don't know. What about you guys?
Thanks, Erica. Yeah, I saw the prevention question was the last one on the list that I got. So we'll just flip it. How about if we do that? So in pediatrics especially, the one thing I would say is a vast majority of the liver diseases, with one exception, are really things that you're born with or things that you acquire and you don't really trigger those diseases. In some sense, there are kidney diseases like that too, where your own body attacks it. But if I think about prevention of liver disease, and if I look across the national landscape, by far and away, the leading cause of liver disease right now in kids and in adults is what we call non-alcoholic fatty liver disease. So that is liver disease associated with sort of the modern world. About 30% of older children and adolescents are overweight, and about somewhere between 10 and 30% of those individuals will develop liver disease with that. So as I think about prevention, I go back to what Dr. Geff said. The most important thing we can do right now for the most common cause of liver disease is actually lifestyle management and weight control. So that's diet and exercise. And it's really easy to say that, but if it was easy to do, we wouldn't have 30 to 40% of the population overweight. But that's the first thing you can do is pay attention to that. And for children particularly, that's a really good time when you can attack that. Because as you know, as we get older, it's a lot harder to lose weight. And the other advantage is if you start earlier in kids, they gain because they gain height. And so you don't have to lose as much weight, you just have to slow weight gain if you're already overweight. But the best prevention is not getting there. So that's eating a healthy diet, maintaining activity. There's a strong association between screen time and weight. So limiting screen time. And then the other major area in the US and North America that we see is consumption of sugary beverages, soda, juice. Those are big components to calories, and they contribute to other factors. So I would start with that. The second thing you can do is there are some behaviors that can increase the risk for development of liver disease. These are a little bit more common in adolescents. I don't see it in 3-year-olds, but high-risk behaviors such as using IV drugs are ways to acquire liver disease. Alcohol, you typically don't get bad alcoholic liver disease in teenagers, but it starts down the path to liver disease. So those are really important things to prevent liver disease. And then I think avoiding hepatic toxins. And so that's a little bit controversial. You'll see a lot of things out there for liver health, but you have to be careful. And I think, so I'll talk a little bit to the transplant community. There's a big interest in complementary and alternative medications, herbal therapies, those type of things. But there are several reports of different types of those therapies that have led to liver disease, and it can be really hard to sort those out. So I think checking with your physician before you take any supplements is really important, even if the supplements say they're going to work really well. But I think those are the main things that I think about when I think about healthy livers and prevention. I'll go back to the question I think Edward asked about exercise. So, physical activity is also very important. It helps maintain a healthy weight, but it also protects you. So I think those are the keys.
Oh, awesome. Great. Sorry, I lost. Erica, can you take the next question? I lost my spot. Sorry. But great responses, great answers, very informative.
Yes, Dr. Narkowitz, I have to argue with my 5-year-old about, he insists, I said, Gatorade, no. He says, it's good for me. I said, sweet boy, you're drinking water. Okay, so he's like, he wants, everyone there has, purple and green and red. And I said, not only, if you want to, do you want to drink Gatorade or do you want to go to Disney World? We're on a budget here. But anyway, those are still sugary drinks that people think, since we're talking about sports, that people think are healthy, and they're packed with a lot of sugar. So I echo what you said about keeping sugary drinks, out of the kids' diet, especially with sports as well. I mean, Gatorade, I feel like is a major culprit. So moving on, our next question.
Erica,
Yeah, sure.
can I say something?
Sure, Dr. Edinger.
We've all said that exercise is important. We've all said that it's difficult to do when you're older. I think youth sports is one of the undersung heroes of child and pediatric health, because youth sports are fun and the kids go out to do it because it's fun. So people should find the sport that works for them, not try to get pigeonholed into some sport the parent likes, and do it and let them have fun, because those kids that are having fun doing the sport young are going to be the ones to keep exercise older.
Yes, I agree. It's all about muscle memory too. And Dr. Edinger, we're going right back to you. So the next question is for you. So please feel free to unmute yourself. Once you're diagnosed with kidney disease, what is your recommendation to patients to have a better quality of life? And I think exercise is probably, and I know Jonathan Traylor can attest to this, he's a huge component of exercise. What are some of the things that people can do to have a better quality of life?
So you caught me with number one, which is regular exercise. Again, exercise has to be something that attracts you to doing it. you've got to really enjoy the exercise, or you're not going to do it. So yes, exercise. What does exercise do? Helps with blood pressure, but it's very interesting. One of the things that it can also do, and I'm stepping out of my role here and getting into my hepatology role, which I'm not. But exercise helps improve the non-alcoholic fatty liver disease. So it's really, that and diet are really, are really quite important. Number two, something that we haven't talked about yet is avoiding smoking and avoiding vaping. These are significant problems. There was just a recent study that came out showing that young women who vaped had children who are more likely to spend time in the neonatal ICU. So smoking and vaping, a problem. Avoid alcohol. Alcohol's a habit that one gets into in teenagers and can be a problem down the line. Weight control, as we talked about, is critical both for developing diabetes, developing hypercholesterolemia, and all of those problems. And then another thing we haven't talked about very much at all, but is really critical. I want everybody to hear me on that. Chronic illness can make you depressed. Depression can really lead you to do things that are counterproductive to your health. If you're depressed, seek help. Seek counseling. Lean on your support system to help you with this. For example, I told you my Philip Jones story. I'll tell you another story of a young man who was 20 years old, had end-stage renal disease, got a kidney transplant. We were worried that he'd forget his medicines, but he was also an outstanding soccer player. So I went to his soccer team, and because they needed him to play striker, I went to his soccer team and I said, you guys remind him to take his medicines. Let him take his medicines at the practices. And sure enough, he went on to play Division I soccer and is now the athletic director of a huge soccer club. So play with the cards that you're dealt. And if there are certain things that are important to you, if your church is important to you, if your sports activities are important, your school is important, help in creative ways to use these. Again, we were talking about promoting wellness. Be suspicious, and again, I'm reflecting what someone else said. Be suspicious of people that tell you that there are diseases that will promote your well. There are foods or herbs that will promote your wellness. Bad story. St. John's wort is supposed to help with depression. There was a heart transplant patient who took St. John's wort. Unfortunately, he was not aware that St. John's wort interfered with his immunosuppression. His heart rejected and he died. So that's very much of an object lesson that be careful. We tell our patients not to take anything without checking with us. And then we go around and do the research to find out whether it interferes or not. So beware internet information, beware get well quick types of responses, and lean on your physicians as well as leaning on your social support.
Wow, that's awesome. This is amazing information. As you all were talking, I was just thinking back to how important the emotional side of it is, and that's a side that people can't see. So, a lot of you would never know. And when we working with the different hospitals across the country, one thing that that a lot of the social workers tell us is how depressed the kids are, and just different things you deal with from the social aspect of it to is a lot of people think transplant is a cure, but it's really, you're living with it every day. It's a treatment more so, a great treatment. But and I've seen teammates die on a field due to heart issues, and maybe been taking supplements and their liver got damaged. So you all don't understand how invaluable this information that you all are giving our audience and the youth, and which will show how valuable it is, because like I said, myself and our team seen it firsthand, which is why we was inspired to do this symposium. So thank you so much. You don't understand how vital this information is. So and moving forward, speaking with the Dr. Dale, Dr. Gill.
Edward, can
Yes,
I
sir.
ask Bob one question? Bob, what about ibuprofen in protection of kidneys?
Ibuprofen and protection of kidneys?
Yeah, either not using ibuprofen, a way to prevent. What about NSAIDs? And
That's actually a bit an area that's got a bit of controversy around it. Whether it has long-term effects. If you've got some degree of kidney disease, ibuprofen will decrease the blood flow to the kidneys, and your kidneys will not work as well. If an individual who is not ill gets incredibly dry, like just runs a marathon, and then gobbles down some of these non-steroidal anti-inflammatories, I've taken care of some kids who have gobbled down some of this because they're hurting after strenuous exercise, and I've had to dialyze them. So even kids who come in with nausea and vomiting, their doctors have given them ibuprofen without a good understanding of what's going on. They've come in kidney failure. So ibuprofen is something one really has to respect and to try to stay away from. Now, I'm not saying not to take it on occasion, but to take a lot of it in a specific instance when you're otherwise somewhat compromised is a real problem.
Anything to add? Anything to add, Doctor? Wow, no.
No, it was just another way. If you have ongoing kidney disease, it might be something to be careful about.
Okay. Awesome. Okay. Dr. Dale Guest, the question: what happens to the kidneys when the heart is not functioning properly?
Well, I mentioned before that the heart and the kidneys are really intricately linked. It's funny, when I see a patient for the first time, particularly if it's a heart failure patient, or particularly if someone gets admitted to the hospital, the first thing I really run to look at is how is their creatinine. And the reason is because the job of the heart is really to pump blood to your whole body, to provide oxygenated blood to your whole body, what we call to perfuse your body. You want to perfuse your organs with a good amount of blood so that they function properly. And we don't really have an easy marker always, at least as a blood test necessarily, to tell us how well the heart is necessarily pumping. But we use the kidney and the creatinine, we use that as a marker of perfusion in many ways. That's not the only marker, but we use that as a very common marker of perfusion to tell us that if the creatinine is normal, the kidneys must be perfusing okay. They must be getting enough blood flow. I remember, it's funny, I remember as a medical student, we were walking through the intensive care unit, and the doctor, these patients were hooked up to a million different machines, and they had tons of medications and IVs, etc. But he said to me, if you couldn't look at any of this information and you could only ask for one piece of information to know how this guy is doing, what would you ask for? And, you know, people said different things. I want to know his blood pressure. I want to know this and that. But he said, urine output. You want to know, how is he urinating? Because if he's urinating well, if his kidney function is good, it's usually a great sign, at least that he's perfusing his body well. And I spend my whole day, you know, especially because I'm as a heart failure specialist, I spend my whole day talking to people about how much they pee. You know, how much they pee, and we measure how much they pee, and the way the heart and kidney interact, there are several mechanisms, but there are two primary interactions. One interaction, as I mentioned, is forward flow, what we call a forward flow, meaning the heart is pumping blood forward to the body and to the kidneys. The kidneys have to see enough flow in order to work properly. And I was assuming there's no obstruction to the flow in the kidney, in the renal arteries or something like that, then it's up to the heart to perfuse the kidneys and pump forward. So if a person has a weak heart, for example, and it's weak and it's not able to perfuse, it's not able to pump enough blood forward, then the kidneys will see that, and the kidneys will sense that, and you'll see an abnormality often in the kidney function because it's not seeing enough blood flow. On the other hand, and probably more commonly than that, is actually what we call congestion. And that is when fluid backs up. If your body is overloaded with too much fluid, let's say because your heart is not able to accommodate all the fluid and the blood flow that's passing through your body, if it can't accommodate the needs of your body, things start to back up. If you have a weak heart, if you have valve problems, if you have a stiff heart, if you have very high blood pressure, people commonly get what we call a stiff heart. So it's working nice and strongly, it's squeezing very strongly, but it's stiff. And when it gets stiff, it's prone for pressures in the heart to rise and fluid to back up. When that fluid backs up, it can back up into other organs like your lungs and your kidneys and the liver as well. And your kidneys, the renal veins of your kidneys, they sense that congestion of excess fluid backing up. That causes the kidneys also to have worsening function and even to fail sometimes. So in those two ways, you know, forward perfusion and backup congestion, those are the two most common means, I think, that we see this interaction between why the heart function is closely linked to the kidney function. And when the kidneys sense things are not right with the heart, it also activates a lot of cascades or mechanisms within the body to what we call neurohormonal dysregulation, meaning a lot of hormones or compounds are released in order to start retaining water, retaining salt, things that are not good for you. But these mechanisms get kicked into action. And that's another way that starts a spiraling of negative mechanisms that affect both the heart and the kidney.
Again, great information. A lot I didn't know, so thank you so much. Take it over, Erica.
Thank you. So moving right along, let's go back to Dr. Narkowitz. So we talked a little bit about prevention. So tell us, once diagnosed with liver disease, if it's not treated properly, what's the right at the right time? How fast can things escalate? How fast can your liver deteriorate if it's not diagnosed, or if the issue with your liver isn't diagnosed properly at the right time?
Thanks, Erica. Do you want to do this one, or do you want to do the first question that might about signs of liver disease before we get to how bad it can get? I don't want to go to a downer first.
I like your logic. Let's go with that. Let's start with that question.
Yeah. So the question was, you know, what are the early signs of liver disease, and what can people do to slow down progression? So in pediatrics and in adults, liver disease is really hard because it can be very silent. But there are really two kind of major things we see in kids with liver disease. And the first one you can be attuned to and find out. So the appearance of jaundice, which is yellow eyes or yellow skin, is a common presentation of liver disease and a first symptom. You may be totally asymptomatic, but you develop yellow eyes. Now, I want to be careful. For those people who've had newborns, they know newborns get yellow skin and yellow jaundice pretty frequently. But buried within that is a small and very small, 1 in about 15,000 live births, congenital liver disease that people are born with, and it's really important to diagnose early. So if you as a parent see that your child has jaundice, you want to get that checked, because the blood test can differentiate between what I call benign or yellow jaundice that most babies get, and not good jaundice, which is green jaundice, and they can do it with a blood test. So that triggers that. Come to the physician or your PA or who it is and really make sure that they check your liver and be sure that the jaundice is not liver disease. And there's a simple blood test to do that. We've found that it's a little bit difficult for access, and a lot of physicians, because they don't see these problems very frequently, might miss it or delay it. So early diagnosis helps with that. The second symptom that you might see is itching. So when you have abnormal jaundice, that can trigger itching. And so that persistent itching, particularly if you have yellow eyes, that's another sign of liver disease that's progressing. After that, it really gets pretty subtle. It's things like fatigue, maybe not as hungry as you were, maybe losing some weight. Those all symptoms, they're pretty vague symptoms, and it requires an astute clinician to figure out that you have a big liver or a big spleen. So seeing your physician for those, and then blood testing. Those are really the things that we can look for first signs. And more advanced signs are if your liver has really bad scarring and you've developed complications, you might start throwing up a lot of blood. That can be really scary, but that hopefully will be diagnosed before that happens. Many of the liver diseases, the good news about prevention or slowing progression is many of the liver diseases over the last 10 years, we've developed actually cures for, or therapies that can prevent any progression of disease, particularly if identified early. So we have treatments for hepatitis C, hepatitis B. We have treatments for autoimmune liver disease that can really protect most children from progressing to more advanced liver disease. So I think the question was really, what can you do to slow the progression? Early identification, and then identifying things we can treat, and then going back, unfortunately, to the basics we talked about, not adding on top of it some problems. So if you have liver disease and now you become overweight, you're going to add an additional liver disease trigger with it, and then watching for medications that can hurt the liver with it. So those are the main things that we can do to slow progression. The last thing we can do is really maintain good physical health. So again, exercise and an appropriate diet to build good muscle mass, good cardiovascular status, that will really help. And that's what we encourage.
Awesome. I have a quick question. Like with us as transplant patients and the various kids we work with, maybe had hearts or kidneys or lung, with the medications we take, we're at a higher risk for liver disease, right? So what type of things can we do to maybe try to eliminate that or avoid it, prevent it, should I say?
Yeah, it's a good question, Edward. First, I'd like to be a little bit reassuring that most of the medications that are used for transplant do not have a pattern of causing liver injury. So that's a really good thing. I think the main things that we see now in post-heart or post-kidney transplant patients are those individuals, again, going back to the most common cause, who are gaining weight, sometimes related to steroids that are used early, or if you have to be more aggressive, that can do that. So those are really the risks that we see with it. Not so much the medications that we're taking. The other thing I will tell you about the reason I did liver disease is I think the liver is forgiving for physicians, because unlike the kidney and unlike the heart, if the liver takes a little bit of an injury and it gets better, the liver regenerates and heals itself. Whereas the kidney and heart, unfortunately, can't do that. And so it's not as big a deal down the road as it has been. Avoiding alcohol I would just go back. Avoiding alcohol is the other one that is really important long-term to protect you post-transplant. You may be at a little bit higher risk of alcohol-induced liver disease after transplant.
Awesome, awesome. Thank you for the information, sir. All right. All
I
right.
had a quick follow-up, Dr. Narkowitz. So right now, this really trendy, the cleanses. I've seen a lot of, I'm watching the medical medium on Instagram. I am intrigued with, celery juice and the whole bit. And so I just like to get your quick take on that, because I'm a huge proponent of, the medical medium and detoxing. I'm sure that the panel after ours will get more into that, but I was curious to say, just now, if we're going to do a detox, how often should we do it? Or is this something that people are just using to take our little dollars, or what do you think?
So I'll give you my opinion. And there's been no scientific data to look at cleanses, and I think there's no evidence to suggest that it will improve liver health with it. We do know that there is increasing interest that what we call the gut microbiome, which is what makes up your gut, can impact your liver, and an abnormal gut microbiome can impact your liver. And there are studies now trying to change your microbiome and improve your liver health. But these cleanses don't really do that. They just empty things out, you're repopulated with the same bacteria you had before, and it doesn't really change. And I worry that you get dehydrated or you have other problems that are going on. So my personal opinion is it's a money sink that is probably not changing your health. I'll be blunt.
Oh, you hurt my feelings. Well, I can put away my juicer and my celery and all of the money I'm spending at Whole Foods on celery, organic celery. Okay, so let's move on. I think our next question, we pop back up to Dr. Ettinger. If you could unmute your mic. I think this is the last question for you, Dr. Ettinger, and we'd like to know, what are the stages of kidney disease and what determines your stage of kidney disease?
To put it in terms that I think, well, let me take a step back. You heard about the serum creatinine. You heard Dr. Stout say about the serum creatinine and how it measures kidney function. In relatively straightforward terms, the serum creatinine goes up out of the range of normal. That's bad. The kidney clears toxins, a bunch of toxins. Serum creatinine is simply the one that is most easily measured and probably doesn't do anybody any harm, but is one that is easily measured. And so it's an index of how the renal function is working. It measures what we call, and measures in sort of a not very precise way, but one that tends to work. It measures what we call the glomerular filtration rate. The glomeruli are the filters. The blood is filtered and material comes out of the blood and gets excreted, and the toxins are in that material. That's what urine is. The creatinine is a numeric value that says that your glomeruli are getting enough function or blood. And that was, again, what was mentioned earlier, and how well the glomeruli are cleaning the blood. So an elevated creatinine out of the range of normal is something to be concerned about. However, there are a number of different things that can also make the creatinine go up that are not necessarily, do not necessarily mean you have kidney disease. For example, one that we see a lot when we go into the intensive care unit or whatever is just what was mentioned before. The kidneys are not being perfused, or not getting enough fluid. And as a result, some of the toxins back up. But it's all related to fluid. And sometimes what we need to do is give more fluid. And the creatinine will go back down. We see that a lot in transplant patients who were on Prograf or tacrolimus. And if the patient gets dehydrated, the creatinine goes up. But all we have to do is hydrate them more, and the creatinine will go down. So the creatinine has some subtleties to it in terms of how you evaluate kidney function. And not every elevated creatinine means you've got irreparable kidney disease. So that's something to keep in mind. If you get a creatinine that's modestly elevated, it's not, oh my God, I'm going on dialysis tomorrow. You need a careful evaluation of why that creatinine goes up. And we have a number of other tools that help that. Now, that having been said, the creatinine is sort of a blunt instrument. And is certainly lacks some precision. So we have other measurements and we use the creatinine, but we use other measurements as well to talk about what the glomerular filtration rate is. That basically says those filters that I talked about, the glomeruli, how well are they working? And simply put, one can look at a value from 1 to 100. And if you've got 100, it's working 100% of the time. If you've got 0, it's working 0% of the time. So we look using some of these tools at this glomerular filtration rate, and we basically sort out what's the percentage of function. Now, I'm oversimplifying here, but I think it makes things more clear to people when I talk about percentages. So if somebody's glomerular filtration rate runs from 90 to over 100 to 110, you're okay. That's a reasonable. That doesn't mean that you can't have kidney disease. You may have protein in the urine. You may have diabetes. You may have other things that can cause it. But in terms of your kidney function, you're in stage 1. Stage 2 is if your kidney is functioning between 60 and 90%. And between 60 and 90%, at stage 2 is a situation where you may you have modest kidney damage. And in this situation, what do you want to pay attention to? You want to pay attention to blood pressure control, because blood pressure can tear up those glomeruli, those filters, and can cause you to have more kidney disease. You want to try to control your diet so you don't have a diabetic tendency, which can help tear up those filtering units. You want to try to control your weight, which can lead to diabetes. Stage 3, some people break it into stage 3A and 3B, but for simplicity, it runs from 30% to 59%. And that's what we call mild to severe kidney damage, somewhere in that range. If it's 31, it's getting to be severe. If it's 59 or 58, it's milder. Again, there are a couple of things that you want to do, obviously blood pressure and other things, but now's the time to talk. We haven't talked about this before, not just to see a nephrologist, but to see a renal dietitian, because you can do harm. We've talked about some of the good things that people think they can do with some of these, with celery and stuff like that. But there are some things that you can eat that can increase your phosphorus, that can eat up your bones. There are some things that you can eat that knock out, that elevate the potassium, that can send your heart significant problems. So dietary management becomes very important at this point. And then, as I mentioned, blood pressure control and phosphorus, potassium intake, sodium intake. Dietary, very, very important. At this range as well, I would begin to think about seeing a social worker, just to be able to discuss what it's like to be moving into kidney disease. What are my feelings about it? How much might I be down and depressed? This is not something one takes lightly. And we need professionals. And just because you see a psychologist doesn't mean you're crazy. It absolutely doesn't mean you're crazy. It means you're smart. Because they help you recognize problems and deal with problems. So I can't say enough about our social workers, our psychologists, to help you see options in your life. It's not being crazy. And I can't say that strongly enough. Stage 4 is from 15 to 30. And at that point, we're talking about severe loss of function. And that's the time that you start to talk with your nephrologist. Do I need to go on dialysis? Can I find a living donor? Identifying your support systems to help you move through this, to drive yourself to physicians' offices, if you can't drive, to begin to think about, looking at different dialysis units, et cetera. This is the time that you want to make plans, because when it gets under 15%, which is stage 5, that's the time that we start dialysis, we do transplant. And they're very close to failure at that point. A small anecdote. As you get more kidney disease, you begin to feel more depressed and foggy and not very sharp. My friend, a close friend who did a kidney fellowship with me back in Philadelphia, more years than I want to count, developed a kidney disease recently, quite a serious kidney disease, and he went on dialysis. After 2 or 3 dialyses, he was a different person talking to me, much more sharp, much more able to make decisions, much more able to advocate for himself. So dialysis is not necessarily torture and the end of the world. It can make you feel a whole lot better. And I know it's hard to say dialysis can make you feel better, but it's very much the truth. And then, we always want to shoot for kidney transplant.
Awesome. Thank you so much for that information. And we have about 8 minutes left. We do want to get everyone out on time. So please take your time, but we want to get you all out on time. So this one goes to Dr. Gail Geft. How does heart post-transplant medications affect the kidneys?
So over the last two to 3 decades of heart transplant, we've really seen actually quite an improvement in outcomes and survival. And a lot of that is attributed to the primary immunosuppression medication we use, which is tacrolimus or cyclosporin, which are called calcineurin inhibitors. That's the class of medication. They've really done wonders for preventing rejection and improving outcomes and survival in all transplants, especially heart transplant as well. The catch to it, and this is sort of the irony, because the kidney transplant patients like you guys, you know these medications. One of the side effects is potential kidney toxicity. And yet it's still used even for kidney transplant. If you look at post-heart transplant patients, it's not uncommon. After about 10 years, if you go out 10 years from heart transplant, about 20% of people will have chronic kidney disease. And a lot of that will be due to just exposure to these medications for many years. There are risk factors to make one more prone to toxicity from these medications. For example, people who go into people who go into heart transplant already with abnormal kidneys. If it's bad enough, we often do a kidney transplant at the same time to try and even the playing field and give them a fresh start for their kidneys as well. But oftentimes the kidney function is not bad enough to need a kidney transplant, but it's also not completely normal, and they are at risk to develop kidney toxicity over the course of time after their heart transplant. So the main, you asked about the medication we use after heart transplant that affects the kidney. That's probably the primary one. There are other medications that we actually probably use much more before transplant, but we also sometimes need them after transplant. That's diuretics. Diuretics can take their toll sometimes on kidneys if they're used too frequently or too high of a dose. Sometimes we have no choice and we need them, but that's another medication that sometimes can cause kidney dysfunction. Aside from just medication, the question was specifically about medication, but aside from medication, over time, there are other things in the post-heart transplant world that could affect your kidneys. Number one, these medications can cause high blood pressure. They can worsen diabetes too. And so you really have to focus on controlling those as well, because that can also lead to worsening kidney function. We also do usually in the beginning of these annual angiograms, which are procedures to look at the blood flow in the coronary arteries of the heart. And that procedure requires giving a dye, a contrast dye. I'm sure you're all aware of certain dyes, iodine-based dyes that can affect your kidneys too. So we have to be very careful with that. If people get infections from being immunosuppressed, and oftentimes that is a side effect we have to watch for, and a complication. Bad infections can also end up harming the kidneys as well. And if the heart itself starts not doing too well at some point, if it starts to fail for various reasons, that can also end up affecting your kidney, like we talked about before. So again, they're very, very closely linked. But the irony of it is the really successful immunosuppression medicine that we use has kidney toxicity, but it's the same one that the kidney transplant team uses. In some cases, we will use protocols where we try to avoid that drug if we need to, if it's hurting the kidney too badly, or we'll lower the dose and use a lower dose regimen to protect the kidneys. Sure, Dr. Edinger can talk about that as well.
Awesome. Thank you so much for the information. Thank you. It's been great.
I had one last question for Dr. Edinger. Thank you, Dr. Geft. So I'm curious, at what percentage kidney function should people start to seek out getting listed on the transplant waiting list? Around what percentage should they start saying, hey, doc, what about this list?
It's hard to come up with a simple answer, but I would say, pulling a number out of the air would be 40. An estimated GFR of 40 would start to be to discuss it, and to discuss that, because 40 is going to be 30 at some period of time. And a lot has to do with how it's progressing. If it's progressing really rapidly, then 40 might be not soon enough. If it's progressing slowly, you might wait till it's 30. 30 is the generally accepted time that we really get into this in big time. But 40 is the time that you start to think about it.
Thank you. Well, I think we've covered all of our questions. I think Dr. Narkowitz,
We have one more for the liver specialist, right? Or did he already answer it?
yes, we kind of bounced around, but he went over prevention. He talked about prevention, but please, Dr. Narkowitz, please feel free to add anything that you may want to include.
Sure. Just a couple of points, Erica. So when we talked about prevention, I neglected to mention one really important aspect for prevention, and that is vaccination against liver viruses. So hepatitis A and hepatitis B can be completely prevented or almost completely prevented with vaccination. And that hepatitis B vaccine both prevents liver disease and it actually prevents cancer. It was the first vaccine therapy for that. So I want to be clear that that's really important in this, no matter where you are in the stage, if you haven't been vaccinated, pre-transplant with kidney or liver or whatever, you should do that. But now we routinely vaccinate all newborns in the US for hepatitis A and B, so that's important. And I think the other part of the question that I was going to be asked is, how rapidly does liver disease progress to liver failure? I want to be a little bit reassuring. In most cases, liver disease is very slowly progressive. It's not a big rapid ramp and you have pretty adequate warning. There are very rare circumstances where the liver sort of acutely fails, much like, I can't remember who mentioned, much like Jonathan, you know, where you sort of had acute kidney failure. There is that in liver, but it's really, really rare with that. So I hope that that helps answer the questions.
No, awesome. Erica, you have anything else to add to these amazing young gentlemen?
No, that was awesome. I really think I learned a lot from all of the doctors, and Dr. Narkowitz, Dr. Edinger, and Dr. Geff. We appreciate you being here. And if there's anything any of you would like to add, please feel free to do so now.
Definitely. And I would just like to add that this has been amazing. I knew it was going to be remarkable, but I was blown away. I felt like I could have just came to you all instead of paying all my money to go to college. But thank you all so much. Like I said, you all were great, and I know the audience will be greatly benefited from this information. So yeah. So
can I say something?
Sure.
I want to thank you and Why Not and everything for this service that you guys are putting out and the wonderful things that you do. I am blown away with all that you've done.
No, thank you so much. That means so much from an incredible young man like yourself. So thank you. So with that being said, we're out on time. So thank you all so much. Give yourselves a round of applause. Like I said, we really appreciate you all, and continue to impact lives. Us patients, I speak on behalf of my team and patients from all across the country. We thank you all for what you do for us patients. You all take care and stay safe. Thank you.
Thank you, and keep doing what you're doing.
Thank you.
Thank you. Great work.
Thank you, sir. Thank you. Tafaro, you can take it over.
Yes, man, that was wonderful. You know, me being a 2-time kidney transplant recipient and listening to them just give me more and more knowledge, because you know, I was listening in depth to all three of them, and they were wonderful. I loved it so much. It was great knowledge, and like you said, Edward, hopefully everybody else took a little bit of those gems that they gave us for our health. One thing that was the correlation with all three of them that I like so much, coming from I used to own my own fitness studio when I was on dialysis, was exercise and nutrition. You heard that consistently by all those gentlemen. They kept on reinventing it, saying it over and over, and that's important. So those are the foundations of things that we all have to do as humans. We have to move our bodies. Our bodies cannot be stationary. We can't live sedentary life. And like Erica said, she snatched that Gatorade out of her face. Give me that. Yeah, that's how my daughter gets mad at me, because I'm like, water, but exercise and nutrition. You heard that theme through this whole thing, and those guys are absolutely right. We have to move those bodies. The younger ones, get them into a sport, something they like to do. Those things are so important. You know, I played sports. I was playing college football when I was diagnosed, just like Eddie. So those things are wonderful. But now we want to move on. We want to move on and welcome Diane Briggs. She's a Community Health Vice President of the American Heart Association. She has a couple words for us. Go ahead, Diane, take it away.
Hi, I'm going to share my screen real quick with you all. Good evening. Can you see my screen, the presentation? Great.
Yes, we can.
I just wanted to make sure you weren't seeing the note screen. You know how that goes with Zoom. You never can quite tell. Thank you so much for the introduction, and so happy to be here tonight. I am Diana Briggs, Vice President of Community Health for the American Heart Association and American Stroke Association in Central Ohio, and happy to be here with you all this evening. And it sounds like I didn't hear the full presentation, but it sounds like I'll underscore some of the recommendations you've already heard this evening. Heart disease and stroke are the #1 and the #5 killers, but 80% of these deaths are preventable through better lifestyle choices. So that's why we're so passionate about overall health at the American Heart Association. Our mission is to be a relentless force for a world of longer, healthier lives. And we do this through advocating, motivating, and creating awareness so people feel empowered to live happier and healthier. We want to help build science-backed healthy habits so individuals can thrive. I want to briefly share about the American Heart Association and our Life Simple 7. The American Heart Association has identified 7 health factors and lifestyle behaviors that support heart health. Research demonstrates that people can improve these risk factors through lifestyle changes to help achieve cardiovascular health. To help share just a little bit more information, I wanted to give the floor to a board member and volunteer of the Central Ohio American Heart Association, Dr. Joshua Joseph. He's an assistant professor of medicine in the Division of Endocrinology, Diabetes, and Metabolism at the Ohio State University Wexner Medical Center in Columbus, Ohio. And so I'm going to let you guys hear directly from him on the importance of Life Simple 7.
Yeah, we can't hear anything. I'm not sure if you.
Oh, no.
Yeah, sorry. I wasn't sure if you was aware of that.
I was not aware.
Okay.
I apologize.
No,
I think I forgot to share with sound. I'm so very sorry, everybody.
Welcome. My name is Dr. Joshua Joseph, and I am a physician scientist at the Ohio State University Wexner Medical Center. I come to you today on behalf of the American Heart Association, where we know that making small changes can have a great impact on your overall long-term health. We refer to these small changes and these levels of control as Life's Simple 7. 7 factors that lower the risk of both heart disease and stroke. So let's get right to them. What's #1? #1 is blood pressure. Blood pressure is the leading cause of both heart disease and stroke in the United States. Thus, controlling blood pressure is critical through either lifestyle modifications or blood pressure medications for those who need them. #2, cholesterol. Cholesterol is that fatty substance in the blood vessels that can build up on the sides of the walls of the blood vessel. And when it builds up, it can actually clog the blood vessel, leading to heart disease or strokes. And thus, controlling blood cholesterol is a great way to lower risk of heart disease and stroke. #3, reducing blood sugar. For me, I am a diabetes doctor. I see patients in my clinic for diabetes. Thus, number 3, reducing blood sugar is absolutely critical for all of us. And I am a huge proponent of the healthy lifestyle behaviors, things like diet and physical activity, to lower blood sugar and ultimately lower the long-term risk of heart disease. Number 4, getting active. People often ask me, well, doc, how active do I need to be? We recommend 150 minutes per week of physical activity. And you might be wondering, well, how intense does that have to be? Well, let me give you a couple examples. 1, if you're sweating, your intensity is high enough. And 2, let's say you're out for a walk. If you're walking and it's just a little tough to breathe or a little tough to have a conversation comfortably, you're probably doing enough physical activity. Number 5, eating better. We know that there are some things that are really good for us. Things like fruits and vegetables, as well as fiber-rich whole grains, as well as non-fried fish. While there are other things that are not as great for us, things like sugar-sweetened beverages or a high-sodium diet. Thus, increasing those healthy things is one long-term strategy to lower our risk of heart disease and stroke. Number 6, for those of us who have a little bit extra weight, really focusing on losing a few pounds is another strategy to lower the long-term risk of heart disease and stroke. And lastly, number 7, for any individuals who smoke, cutting back and ultimately stopping smoking is a key strategy to lower the risk of heart disease and stroke. That's it. 7 simple factors that we know are critical to lowering the risk of heart disease and stroke. So I want to leave you with a website you can go to perform your own Life Simple 7. That website is heart.org/mylifecheck. Once again, that is heart.org/mylifecheck. Go there, do your Life Simple 7 so that we can all lead healthier and longer lives. Thank you so much. Welcome.
So as Dr. Joseph shared, we encourage you to take the My Life Check assessment, and it was at mylifecheck.heart.org. You can go to that website and input your numbers and receive your own personalized health assessment and heart score. And you don't have to be a part of an organization. You just go and enter AHA022 to get started. Then you have the ability to create an action plan. You can choose one of the simple action plans that are available based on your personal assessment, print it out and start working from there. So all small steps can make a big difference when you're working towards improving your health. And finally, you can share your commitment with somebody, share the tool with your friends and family, and so they can also learn about their cardiovascular risk and take action to improve it. I just want to thank you again for your time this evening, allowing me to share a little bit of information. And you can visit heart.org for all kinds of additional information if you're interested. Thank you.
Thank you, Diane. That was wonderful. And thank you, Doctor. We appreciate all the information from the American Heart Association. Those guys are doing wonderful work, especially at the James. That's where my first transplant was. So I got to give y'all nothing but love. Oh, wait. You're right. Much love to those guys. All right, moving on. We have panelists Sharon Rouse and Philip Jones. They will be the panel hosting the our Why Not Spread awareness panel. This panel will be a great addition to what we just heard. So Philip and Sharon, take it away.
Thank you so much. And I must say that the segment before this was a perfect segue into the direction we're going in with our wonderful panelists today. And so when we get to you, if you would briefly introduce yourself, and then we'll jump right into the questions. I'm excited to know and extend the conversation from our first session. So we heard from the nephrologist, we heard from the hepatologist, we heard from the I said nephrologist, I think, but we heard from several doctors. And so now I feel like we're getting down to the practical ways that we can then take the knowledge and the advice that they've given us to extend it into our daily lives. So I'm looking forward to this. We're going to start with our nutritionist, Tiffany Archibald. And if I mispronounce any names, please correct me. So would you just tell us a little bit about yourself and what you do?
Hello, everyone. Thank you guys so much for having me. It's truly a blessing. I serve in many roles. My name is Tiffany Archibald. I am a certified holistic health coach. I am a 2-time kidney transplant recipient. I previously did about 3 years of work with my own nonprofit, Community Kidney Care, and then transitioned full-time with the National Kidney Foundation. So I have that background in nonprofit kidney health. And currently I am a clinical liaison with Dallas Nephrology Associates here in Texas. So glad to be here, and I'm excited to discuss whatever I can to inform you guys.
Wonderful, wonderful. Wow, what a wealth of knowledge you're going to be bringing to our panel tonight. Next, we have our pharmacist. We have Salary Trayor. Did I say that correctly? Oh my goodness. Welcome. Please tell us about yourself.
I'm sorry, I'm like going on and on mute. Hi, good evening, everyone. I'm Sally Traore. I am a chronic disease state management pharmacist at Carroll Hospital. It's in Westminster, Maryland. My current clinic primarily focuses on COPD, diabetes, heart failure, and anticoagulation management. I am a 2-time kidney transplant recipient, and I am only 9 months out of surgery currently. So, thank
Awesome, awesome. Anything towards that 1-year mark, we celebrate each milestone. So congratulations.
Thank you.
Congratulations. Next, we have our fitness coach, Mr. James Smith. Would you introduce yourself, please, sir?
How you doing, everybody? I'm James Smith. I'm 24. I'm from Columbus, Ohio. I'm a certified personal trainer, and I'm also in the military. Yeah, I'm crazy about fitness. So pick my mind, ask me any questions you have.
Awesome. I'm sure we're going to have plenty of questions come through tonight about fitness and just practical things we can do in our everyday lives. And then we have our final panelist, Dr. Christiane Drake. She's a dentist. And would you briefly introduce yourself, Dr. Drake?
Hi, good evening, everyone. I'm Dr. Christiane Francisco Drake, and I am a general dentist here in Atlanta. I actually practice at a nonprofit community health center called Good Samaritan as the dental clinic director. And I've been living here for about 6 years by way of Baltimore, Maryland, University of Maryland, by way of Columbus, Ohio, the Ohio State University. So good evening.
Wow, I can definitely connect because I live in Maryland and my sister went to Ohio State and she's now in Toledo, Ohio. So I was connecting all through your introduction. Yes. So we're going to get started. Mr. Philip Jones is going to start with our first question, and we're just going to kind of go around and just have a good time and share knowledge and practical ways that we can continue to take care of ourselves as we spread awareness.
Thank you, Ms. Ross. I appreciate that. First question is for our nutritionist, Ms. Archibald. What do you recommend as a healthy breakfast, lunch, and dinner?
Okay, that's a really good question. Again, after my first transplant, I wanted to get so engulfed in all things health, fitness, education. I had already had a background, obviously. I didn't tell you guys, but I did play college basketball. I'm a Trojan. I see a lot of UCLA people on this panel. But I am a USC Trojan. I played college basketball. I played professionally in 3 countries. And so health and, oh, I see some people not liking USC. What's going on? Pac-12, what's going on? Okay. Just as a patient, after that first transplant, I really wanted to get an understanding of when you're an athlete, you think you eat healthy, you think you work out all the time, you think you're the end all be all to health and nutrition. And in fact, you have that one meeting or so with your renal dietitian, or you see a nutritionist, and a lot of that stuff kind of, you get a packet after your transplant and it kind of goes over your head and things like that. And so I wanted to ensure that I really got the basis and really got the knowledge. And I started looking into bioindividuality. I started looking into eating for your blood type. That's not kind of what we're talking about today. As far as youth and as far as any transplant recipients, you want to make sure that you're eating as many whole foods as possible. You want to make sure that you're eating as many or as less amount of shelf foods that have a shelf life. So for example, for breakfast, you could do overnight oats is something that meal prep is going to be your key to ensuring that you're eating healthy, to ensuring that you are making sure that you're getting those proper nutrients. So something like oatmeal, if you do overnight oats, you can add chia seeds, you can add flax seeds, you can add those additional supplements of protein that aren't that animal protein. So you can do some overnight oats, you could do some boiled eggs, cut a yolk per 50-50. You could do some whole wheat toast, maybe some scrambled eggs. And then I don't know how much you guys are meat connoisseurs. I try and limit that as well. If you want, look into the kind of pescatarian diet, stay away from the raw and the mercury. But I noticed that my levels are a lot different with my protein when I'm not eating as much chicken. I gave up red meat after my first transplant. It's just, as you guys know, the basic knowledge, your kidneys do have to work a lot to process that red meat. So that's an example of some breakfast. Obviously some smoothies, again, throw in those chia seeds, those flax seeds, anything that you have, those natural supplements. For lunch, I jotted some things down like some tuna salad. Instead of eating it with bread, you can choose some whole wheat crackers. You can do it with some croutons. I know it sounds crazy, but it's actually really good. Chicken salad. I would stay away from a lot of the processed meats. A lot of times with processed meats, what happened is preservatives, a lot of sugars, a lot of added sodium. So with that being said, you guys want to kind of stay away from those. If you have to have lunch meat and if you're on the go, maybe grab it from the deli as opposed to the ones that are sitting in, the little meat section or whatever. For dinner, we are in the craze of the, what am I trying to say? The air fryer. Everybody has an air fryer. Everybody knows how great it is to cook with the air fryer because you don't use oil or use a minimum amount of oil. So start looking up some recipes with there, but just throwing in some chicken in the air fryer, throwing in some lean fish. And then when you throw that in the air fryer, choose some dipping sauces. If you're gonna do, I'm talking to the kids, of course, if you're going to have them, with their chicken nuggets, look for barbecue sauce or ketchup or mustard that doesn't have the high fructose corn syrup in it, that is a little bit healthier so that they have that option. Jasmine rice, brown rice, quinoa, those are different options that you guys can all choose as a dinner option as well. And then obviously your veggies. Green veggies are our best friend. Consume as much of those as possible. When you're a child, when you're dealing with the youth, throw those veggies into a smoothie so that they're not realizing that they're actually eating the veggies and they're getting all their nutrients. So those are some of my suggestions for breakfast, lunch, and dinner.
Awesome. Great ideas.
Could I add something? Could I add something real quick?
Sure, absolutely.
Yes, sir, Mr. Smith.
So I actually just got done with the bodybuilding prep. And with that, you don't want to have high fructose sugars and things like that. A good sauce source is G. Hughes Sugar Free. Great sauces, and they have a variety of everything pretty much. So I love that from Tiffany. That was perfect. That is something I use my entire prep. I would definitely recommend that. And the flavor is definitely
And
great.
Flavor God. I didn't even get into the Flavor God seasonings. He knows what I'm talking about. They have either no MSG, they have no sugars, and they have pretty much every flavor. So you're not trying to combine a bunch of spices. You know, they'll have taco seasoning, they have garlic, they have, so he's not in his head. If you guys want to look up Flavor God, they have an IG page, but that's what I'd season a lot of my foods with as well.
Awesome, awesome. And also Mrs. Dash has some good flavors as well. That's another one that I use. A lot of the herbal ones and just the table blend, all of theirs are pretty good as well. So that was very good. And I was happy to know that I do consume a lot of the foods that you mentioned. And so I was like, okay, I'm on the right track. So thank you so much. Thank you so much. So our next question, we're going to go over to Ms. Trayor, our pharmacist. We just wanted to know what happens, because sometimes I know as a kidney warrior, we take a lot of medications. Sometimes we may not pay attention to the dates on our medications and, you know, when things have expired, or even just over-the-counter medicine that's in our cabinet and they have expired. What can happen if we take medicine that has expired?
I love this question. I really like this question because in my ambulatory practice, the majority of my time is spent doing comprehensive medication reviews with patients when they come in. That's usually step one. I'm going through to check to see if there are medications that they're bringing with them, if they're within date. So the biggest concern with expired medications currently is really over-the-counter medications. And a lot of people are actually purchasing things right off the shelf and they're not checking the expiration date and bringing them home and taking it with the assumption that the drugs are still within date. So the most, like if we were to classify the most problematic by drug classes, antibiotics, for example, they have strict expiration date on them. And the only concern you're really going to have with antibiotics, if they're expired, it's that they're not going to work. So you take it, but what you want from it, which is to just clear the infection, it won't work. With expired blood pressure medication, that's probably the #1 prescription medication that I encountered that's expired. Expiration dates are set by the FDA based on regulation. It's a pure regulatory thing. Majority of the time, the medication date that's on the bottle, the drug still has like active pharmacologic effect well after that date. But you don't want to take drugs that are out of date for the simple fact that they may just not work, because we can't guarantee how the pharmaceutical company made a certain medication. One medication with one name could have several manufacturers. The manufacturer could put certain preservative in their medication that could keep it in date up to 2 years after the date that it's on it. And certain manufacturers may not spend the extra money to add that excipient. And so 2 months after it's expired, it's done with. So the biggest concern is that the drug no longer has its true pharmacologic effect, or that the pharmacologic effect you want from it is reduced by the time you take it. Other medications where you're concerned about actual toxicities happening, again, or things like anti-diarrheal medications that we pick up over the counter, very specifically things like Pepto-Bismol. That actually has had documented adverse effects of patients taking the Pepto-Bismol and then ending up with GI bleed, or which is just abdominal bleeding from their gut. But for the majority of the medications, it will depend on what the medication is. So my advice is always, whatever date the pharmacy has on your bottle, don't use it beyond that date, because there's no standardization in which medications are going to be safe and which ones aren't going to be safe. Just don't do it. The only other one I wanted to comment about are what we call bulk items. So creams, inhalers, patches, and things like that. Patches are notorious to absolutely have zero therapeutic effect in it after their expiration date. They're probably the worst ones at that. But inhalers, your pharmacy will normally, again, because of FDA regulation, put 1 year from the date that they dispense it. But the inhalers, if it's not a steroid, they tend to be good for up to whatever that manufacturer's expiration date is on it. So while the biggest risk is that it's just not going to work, you're taking medications that's not going to work, and you're exposing yourself at that point in time to just what's called excipients, which are just the extra things that are put in the medicine to keep the pill or the capsule together, the sugar and all of the other extra things that they use to pack the pills. That's all you're putting in your body, but the pharmacologic agent itself is no longer active. But overall, it's just not recommended to do.
Thank you so much.
Sure.
Thank you. That would remind me to go clean out my medicine cabinet when we get over here. All right, appreciate you. So my next question is for Mr. Smith. How much should a person exercise a week?
I'd say about 3 to 4 to get a good routine. If you're struggling to get started with everything, I would maybe say about 2 to 3 just for recovery purposes and, to stay motivated with everything. I find a lot of times when people want to get in the gym, it's hard for them to stay motivated. I would say to start off, if you don't really know what you might be doing or what goal you're trying to achieve, I would maybe hire a personal trainer, even talk to a nutritionist. As you see, we have one on the call, and I'm sure she does a great job. I would definitely go to her. I'm a personal trainer. I have a business and I've been doing well with it. And if you ever need anything, I'll make sure I leave my information at the end. But I think it's good to get the motivation so that you can stay consistent. Because once you get that consistent flow, then you start to jump into the nutrition side of things. And it becomes I don't want to say easier, but it makes it a lot, it makes more sense for you to jump into the nutrition side of things. So once the consistency hits, it's a perfect flow. It all just comes together in one.
James, I want to ask you a question. What kind of exercises should they be doing?
I like a lot of the cardio exercises, actually. I think and that's another thing. I'm glad you asked that, because I want to reiterate that when you work out 3 to 4 times a week, or maybe even 2 to 3 times a week, that can be, like the doctor said earlier, that could be you doing anything that gets your heart rate up. So even if that's you going out for a walk or jumping on the elliptical, doing the Stairmaster, whatever you might be motivated to use, I feel like is a great workout regimen. Don't look into much of what you see on social media or what you have other people telling you need to do. If you're getting the heart rate up and you're spending the time, the 30, 45 minutes to an hour, actually doing these things, your heart rate is going to go up, and then you'll be sweating, and then your heart will thank you later.
Thank you.
Thank you, sir. Thank you. Appreciate it. Sharon has the next question.
Great advice. So we're going to go to our dentist, and we want to know how we can go about. So we've talked a lot about what we put in our mouths, how we maintain our bodies and everything, but sometimes I think we forget about our oral hygiene. And so what are some ways that you recommend that we maintain our oral hygiene?
Well, I'm gonna start with the things that, anybody who's been to the dentist has heard 1,000,001 times. So brush your teeth, floss your teeth. But more specifically, so we want to be brushing at least twice a day for 2 minutes each time with a soft bristled toothbrush. I recommend power toothbrushes if you can get those, because they really do a great job of getting missed areas and cleaning efficiently between your professional cleanings. And then if you get the ones that sometimes they have pressure indicators, so it'll show you how hard you're brushing or if you're brushing too hard. You want to avoid those medium or hard bristled toothbrushes because they can really wear away at your enamel. And then obviously you want to be flossing at least once a day, because that's really the only way that you can clean in between your teeth. Mechanical, like the water picks, are really good, and it's like a good adjunctive therapy, but it doesn't replace physical flossing. So, and it's a good start if you're, lazy and you just want to get something done. but you really want to use it in conjunction with regular flossing. And I like the string floss better even than the floss picks and the, all the different things that they have out. That's really going to be the most ideal thing. But, whatever works to get you, get you started. And then for your toothpaste, we're still using fluoridated toothpaste. I know there's a lot of things out there in the internet. Sometimes we have to fight against the internet, but fluoride is still the best way to go for your toothpaste, because that's the thing that's going to help you fight against cavities and keeping your enamel strong. Another thing is obviously watching your diet. A lot of times when we think about cavities, we're thinking about the sugary foods, the gummy bears, and the sticky foods, now and later, all that thing. But one thing that people tend to overlook is foods that are like refined carbohydrates. So pastas, breads. I'm not telling you not to eat those, but all those things ultimately break down into sugar. And so you still want to be mindful of that and still be brushing your teeth, because somebody can have like the perfect diet and still wonder why they get cavities. It could be something with that. And then your drinks are really, really important. If you are drinking a lot of soda, a lot of acidic beverages, those can break down your enamel and make you more susceptible to getting cavities. And so if you are going to drink something like a soda, you want to drink it like in one sitting with food instead of throughout the day, because you want to make sure that you're, not exposing yourself throughout the day, and you want to wait at least 30 to 60 minutes before brushing your teeth, because ultimately, if you brush your teeth right after, what you're doing is scrubbing in that acid and just wearing away your enamel. And then the last thing that I would say is, two things. Obviously, you're brushing your tongue if you want to have good health and good breath, and using the mouthwash. And then one other thing I was going to say is the importance of, a lot of people just brush once a day and it's in the morning, but the thing about it is the brushing your teeth at night is actually most important, because when you sleep, your mouth is dry, you're not salivating. And so your mouth is really, that's when it's the most susceptible to getting decay and all the disease. So ultimately, you want to brush at night. And if you care about how your breath smells, you're going to want to brush in the morning. So at the very least, you want to brush twice a day, if that's any motivation. So, yeah.
Yeah, that's so good. And that's much, I don't think we think about that, especially with taking transplant meds and stuff, where your immune system is suppressed and we're more susceptible to infections and things like that. But the importance of even getting between your teeth and all of that can aid in us preventing infection as well. And so that was great information.
Thank you.
Thank you. Next question is for Mr. Archibald, and what are some ways that you would recommend to get our kids to eat healthier?
Okay, that's always tricky. First, if your kids are young enough, let's start them on better habits. Let's not even introduce a lot of the high preservative shelf life foods. So that's number one, if your kids are still young and going through, experiencing kidney issues. Another thing I mentioned earlier is putting all those veggies and fruits in a smoothie. And not only doing that, but also making food fun for them, allowing them to be involved, so that when it's time for dinner or if it's time for a snack, say, hey, want to have some fun? Here, grab some blueberries, cut it up. Kids are so young and impressionable that when you include them in things such as, making food for themselves, they feel a sense of accomplishment, and then they can say, well, hey, if they don't like it, okay, what do we need to add into it, so that they have that accountability in, making some of the foods for themselves. I jotted down something. Another thing is the habits that they form. It's not too bad if you're one of those parents, and it's a lot of them out there that have, allowed their kids to, eat. These hot chips are like taking over the entire universe, like the hot Takis and the And the kids are walking around. I used to teach high school back in the day, health, and it's like their fingers would be stained red. So even though you may have or may be a victim of allowing your kids to have that one unhealthy snack, but that unhealthy snack turns into something that they're kind of codependent on, then you have to start pulling it back, looking at the healthier options of chips. They want something crunchy. Even with food creativity, taking healthy food, like the simplest thing is like ants in a boat. So that's taking the celery, slapping some peanut butter in the middle, and then putting the little raisins on it. Any type of creativity that you can get the kids involved in, I think that's a way to get them to eat healthy. And just let them know, if, especially unfortunately, if you have a child that's on dialysis and their diet is very restrictive, and they get sick, you have to say, hey, remember when you got sick and we ate a little too much of A, B, or C, or we drank a little too much, of soda. We have to cut back on that. And speaking of soda, just remove it from their diet completely. There's so many, seltzer waters, flavored waters that they can, take, that they don't have to be consuming those carbonated drinks that are full of sugar.
Wonderful, wonderful advice. And I was on Facebook, I think it was, and a lady had thrown her son a birthday party, and she had all of the characters from Sesame Street, and it was fruit, but it was arranged. And I was like, wow, I can see. Yeah, so it was like Elmo, and it had like strawberries and other fruits on there. And so I was like, wow, that's a creative way to enjoy a birthday party, because when you think of a child's birthday party, we think about a lot of sweets and a lot of junk food. And so it was just a table full of fruits, but they were different Sesame Street characters set up, with their faces. And I thought that was so creative, so creative.
So creative and so healthy.
Yes. So Ms. Treya, we're going to go back to medication. And, this is a hot topic with kidney warriors. And so it's important for us to know what we're doing and how we should best preserve our medications and what to do with them. And so it's a two-part question. How do we prevent medication from interacting with each other? And then also, do you prefer that warriors and patients talk to their pharmacists about their medications?
Yeah, I'm going to take the second part and make that first. Absolutely. Your pharmacist is the most accessible person that is dealing or a part of your care. They're in the community. You don't need an appointment to see one. You could call in and ask to speak to one. They're accessible. And so your direct drug-related questions, like, I'm having a headache and I'm taking a blood thinner, can I take ibuprofen? The pharmacist can intervene right there and tell you no. If you're taking a blood thinner, the safest thing you can grab over the counter is Tylenol. I wouldn't recommend that you take any naproxen, Advil, ibuprofen, or any of those things, because they can increase your chances of having a bleed. So yes, my advice is absolutely utilize your pharmacist, because they are a wealth of they have a wealth of information in guiding you if for whatever reason you're unable to get through your doctor's office, to guide you in a more specific way, right? As far as drug interactions are concerned, today must be like a drug interaction. Like, I just got out of class. I was teaching drug interactions and pharmacogenomics today at the University of Maryland. So we just got done talking about drug interactions. But there are so many different things that we can do to try to prevent drug interactions. And not all drug interactions are harmful. I think that drug interactions get a bad rep, in that if you have a drug interaction, it's going to be a negative outcome. We're constantly exploiting drug interactions to try to get maximal therapeutic outcomes, or we want to have an exaggerated response or have a response happen quickly. We do exploit drug interactions to do that. But it's just because of how available things are over the counter, it's an area that the doctors keep an eye out for, and we absolutely keep an eye out for. Some simple things that you can do is, at no point in time should you initiate anything over the counter without having it go through the doctor. And I think some people, they don't think herbal and natural products count as drug interactions, but they do, right? Like, St. John's wort, ginseng, any of these natural herbal products that you have over the counter can absolutely increase or decrease how your medications work. So before you take anything, if you're especially tacrolimus and mycophenolate, they are notorious for how over-the-counter medications can interact with them and decrease how well they're working to preserve your kidneys. So don't start anything before speaking to someone. The other common drug interaction that goes unrecognized is acid suppressors. So the Nexium, the Protonics, the Toms, and all these different things. But sometimes we're able to manipulate those drug interactions. We can just advise patients and say, if you're going to need to take Toms, or if you need to take Nexium every day because of heartburn, you want to separate it out. Maybe give your transplant medications a good 4 to 6 hours before you take anything for acid suppression, right? Because the tacrolimus, for example, is absorbed further down in your stomach. It's absorbed in like the beginning of the small intestines. So you don't want to do anything drastic that's going to mess with the conditions in your stomach with acid production. That's going to alter the way your intestines are actually going to absorb the tacrolimus when you take it. But separating medications out is one way that we tend to deal with drug interaction. But my biggest advice to any patient is just making sure that the people that are on your team that have direct input on how you take your medication, the pharmacist who's dispensing it, if you're interested in trying anything herbal, multivitamin, minerals, over the counter for pain in general, make sure that that goes through somebody and that somebody has access to all of your medications and they can do a thorough review and tell you, yeah, this is safe, you can do this. Or they can say, you know what, it could be safe, it may not be safe. I'm going to tell you to hold off until you actually talk to your transplant center or you talk to your cardiologist or whoever's in a position to make that decision.
Wow, you said a wealth of information. I was just thinking, I also see a naturopathic doctor. And so I'm always having those conversations because there's some things, especially for females over 40, that we cannot take certain things after transplant. And so, you know, I've had to go to a naturopathic doctor and kind of play around with some of the supplements that I take in order to deal with some of the perimenopause and just different things that happen as a result of going through kidney disease. And so that was very, very helpful. Thank you so much.
Absolutely.
Thank you, Sharon, for bringing up supplements, because that brings me right into my question. Mr. Smith, what are your thoughts of taking supplements, and do you recommend or prefer people take them?
So I'm actually a firm believer in diet first. So if I have a client who is going to ask me about supplements and thinks that it's the end all be all, I let them know right off the bat that without the diet, it's not going to work. Actually, you might be hurting yourself more by not having a proper diet and taking those supplements. I'm actually with a supplement company, and they're sponsoring me. So I have a lot of people who ask me about, oh, should I get this product, or oh, should I add this to my diet? And first thing I let them know is it's not exactly 100%. So it's not going to be what you think it's going to be. It's only an assist compared to the actual point. And a lot of people respect that because I could easily just give them a discount code and, hey, go buy this product, it'll be perfect for you. And they, you know, most likely would do it because they see me and they're like, oh, okay, well, he takes it, it'll be okay. And I feel like that's something that is very taboo in the social media world, is that we see somebody who is advertising a product and we instantly think that it's going to get me the results like that. And it's not. And sometimes it's not even going to get you the results. 9 times out of 10, the person's not even taking that supplement. They're just advertising it because they're getting paid to do it. So I think the biggest piece I can give is with supplements to, one, do your research, know each individual supplement fact, so that you aren't using something that potentially might harm your body, something that you might be allergic to, because it will tell you exactly what's in the ingredients. But you also want to make sure that that's something that you're not allergic to, or else you'll have a bad reaction to it. I know with things like whey protein, you have people who are allergic to dairy, you know, with being lactose intolerant. And I'm one of those people. And I have to be careful because I don't like having a bad stomach. That is not something that anybody wants. And I guarantee I can speak for everybody on that one. You don't want to have a bad stomach. And sorry about that, my phone's almost dead. So it's important to, one, read all the facts, two, know what you're consuming, because if you're putting something in your body, I would hope that you would want to know what it is. And three, also know your health. Go to a doctor if you can. I know some people just rather take it and just, you know, see what happens, but, you know, take control of your health and make sure that you're really investing in yourself. If you're investing all this money into these supplements, you should definitely, for one, take care of your body first and invest in your body, most importantly. So that's my take on supplements. They can help, and I'm a firm believer that they can help, but they're not the end all be all. They're just an assist.
Hey, James, that's great. Like I said, I was a personal trainer at one time in my life. One thing I will say when it comes to transplant kids and transplants myself, when I got my second transplant, I went back to working out and lifting weights and stuff, and I started taking whey, and my creatinine jumped up. And I just want to tell everybody on this panel and everybody who's listening, you know, we have transplant patients listening. The whey is a fast-acting protein, and my doctors told me anybody with a transplant, they don't want to take anything like a whey because it can make your kidney work harder, and that's what I was told. So therefore, I just want to, you know, reminder to everybody, we can't, you know, you can't take these things when you're, you know, a transplant recipient like myself, because they make the kidneys work harder. And I just wanted to piggyback off what you said, because that's a no-no, and they can make your creatinine bump up, and that's very, very important. You don't want that to happen. So just wanted to tell you that, though.
Great advice. Great advice. So Dr. Drake, we're going to go back to you with our oral hygiene. And so what are some signs of gum disease, and how can we prevent getting gum disease?
Okay. Well, I'm sorry, my dog is distracting me. All right. So gum disease, there's two different kinds of gum disease. There's the gingivitis, which is really just inflammation of the gums, and that's reversible. And then there's periodontitis, which is irreversible. It's when you get bone loss. So if gingivitis goes untreated, then it leads to periodontitis. And what periodontitis is the bone is what holds your teeth in place. And so the more bone you lose, you know, your teeth can start to move. So gingivitis, some signs of gingivitis are, you know, if your gums bleed when you floss or when you brush your teeth, if your gums are puffy or look swollen as opposed to looking they should be really firm. Another thing that we look at is the color of your gums. We like for them to be somewhere between like a light pink, a coral pink to, for African Americans, sometimes we have what's called physiologic pigmentation, where you'll have like the darker, the deep browns and deep purples. That's normal. But if it's like a bright red or a bright pink, you know, something like that, then that's a sign of gingivitis. And so if you have, and that can also be a sign of periodontitis. And now if you're starting to get something called calculus, which is basic, or tartar, which is when your plaque, if you leave the plaque in your teeth and you don't brush it away, it becomes hard. And that plaque, that calculus releases bacteria. Okay, sorry. That plaque, she decided to start playing with her toy. I apologize. So that plaque starts releasing bacteria, which is what causes the bone loss. And so the calculus can be sometimes like a yellow or a white chalky substance, or it can be brown. Your teeth, if you feel that your teeth are starting to move or starting to shift, like some people come in and say like, oh, I'm getting gaps in my teeth, or if your teeth start to look longer than they did, I mean, sometimes that's recession, but a lot of times that's bone loss. It's a lot of different things that could make you, could be telltale signs that you have periodontitis. Some things to do to prevent that would be, obviously, you just have to go get a professional cleaning, because once you get that hard calculus, there's no toothbrush that's going to remove that. You have to get it professionally removed, and obviously doing your brushing and your flossing. So.
Wow, and I think that's important as well, since a lot of transplant recipients or even those that aren't to the transplant stage are taking steroids and different things like that that can have an impact on your bone health. And so I think that it's so important that we stay on top of that, our oral hygiene, to make sure that we're addressing those concerns and can catch it early before we have to go through a lot of different changes. So
Absolutely.
thank you so much.
One thing I tell a lot of my patients is only floss the teeth you want to keep. You don't want to, you're going to lose your teeth, and don't floss. It's fine. But if you just want to floss the front, then okay. So yeah.
All right. So our next question, we're going back to the top, is for Ms. Archibald, which is, what is the difference between a diet to maintain your weight and a diet to lose weight?
Okay, I think the first thing, and I know that James would agree with me on this, calories in versus calories out. Okay, it's so simple, but people overcomplicate it. And not to say that everyone is going to sit here with an app or MyFitnessPal or all of these different things and be, counting calories. But if that is your goal, to lose weight, then you do have to monitor what your input, what you're consuming versus what you're outputting. So I think that's the first thing to kind of get your mindset on what's a healthy diet. A healthy diet, maintaining it is meal prepping. I cannot express enough how convenient. One, it's convenient. Two, it's cost effective. Three, it keeps you prepared so that you're not going and grabbing and making those last minute bad decisions. And we as transplant recipients, some of us, I have high blood pressure. I'm on like 2 different medications. Like, I can't afford to go to eat out all the time and be wondering how much salt they're putting in it, because when you look at the menus at restaurants, it's a calorie count, but it doesn't count how much sodium is. And what sodium does for a lot of us transplant recipients, we're retaining that salt, and that's bloating us. That's, making us feel heavy and puffy. I mean, we've all been there. You get home from dinner and having some drinks, your rings fitting tight, your heels, you got the lines over your toes where your straps were. So those are indicators of things that you have to pay attention to what you're consuming. And then as far as if you're trying to lose weight, again, you have to, one, if you're a transplant recipient or a CKD patient, consult with your renal dietitian, because everyone is different. That goes back to what I study, bioindividuality. So I can't give a blanket statement on a diet, but if you are under the care of a physician, they can kind of tell you based on your medications what's healthy for you. But it's not complicated. Stay away from foods that have a shelf life, eat more fresh fruits and vegetables, eat more greens, stay away from dairy. There are so many coconut milk, coconut yogurt, different supplements that don't have dairy that give you that same taste that you feel like you're missing. Don't have FOMO, fear of missing out. You're not missing out on anything, because if you're on a diet and you're trying to lose weight, obviously you overindulged in some of the things that you felt like you had to have. So now you know how that affects your body. You got to cut back on that. You got to change your mindset. You got to change your approach. So if I could leave with anything, it is to ensure that, they got the 3-part containers at Walmart, grocery shop on a Saturday, do your meal prep on a Sunday. Don't try and do them both in both days, because that's too much, too many hours gone, and you are just over it. So separate those days that you meal prep. And I think meal prepping will definitely help you maintain a healthy weight, a healthy diet, and just, make you feel energized. We take enough medications that make us feel sluggish, or if we eat something that, like the pharmacist was saying, it contradicts with it, we don't want to have those feelings. So if we can control what we're eating and ensuring that we're not making ourselves feel worse and sluggish, then take that priority to meal prep. because you know what you're eating.
Can I add to that real quick?
Yeah, go ahead.
I actually am working with a client currently, right? So he is a truck driver, and I completely changed his diet significantly. He was going from out to eat every day on the road. He's it's making it quick for him. I had him start meal prepping and actually got him on a consistent diet. He said, oh my goodness, I can stay up the whole time while I'm driving. My energy's changed significantly. People tell me I look better. My skin's glowing. I was like, see, this is why we get on meal prepping diets. This is why we stay consistent. So I love that piece. Thank you for adding that.
You mentioned, truck drivers, because when I was with the National Kidney Foundation, we found every time that there's a truckers convention, those individuals are the most at risk because of what you just described. So what we would do is find these trucking conventions where there's thousands of people coming to town, and we would do free screenings and right there on the spot, test their urine and do their creatinine, because a lot of them don't go to doctors. They don't have the time. Some of them don't have the great insurance. And like you said, they're constantly eating on the road, and their diet is what is essentially causing their diabetes, causing their high blood pressure, where the two main causes of chronic kidney disease. So I'm gonna be quiet.
Nah, don't be quiet, because what you're saying is awesome. But I gotta take something from you, Tiffany. That FOMO, fear of missing out, that's big right there. That is big. I gotta steal that one from you, because I see a lot of people feeling like, if I don't get that sugar or sweet, if I don't have that dessert, I missed out. And that's a big phobia that we have, and we have to correct that as people. So that's big right here. Thank you for that.
You're welcome.
Yes, and I think sometimes we get caught up in the now, and this is what I want now and how I feel now. So I want to eat what I feel now. I'm feeling bad, so I need a piece of cake to make me feel better. But there are consequences with that. Then you're tired and you're sluggish and you can't function properly. So it's like we want that temporary benefit, but then what comes behind that oftentimes is not the best thing for us. But if we just take those small steps and practice doing the things that we need to do with our health, then long term, we see those benefits and we do feel better. And so it's about making those choices every day, because honestly, you're not missing out. You're not. And so we're going to come back to you, Ms. Trayor. We want to know a little bit about compliance. And I know for those of us that do take medications, that can be a huge concern. And what do you think are reasons that people aren't compliant when it comes to taking their medications? And how do you recommend that we stay compliant? Like, what are some things to help us stay compliant in that area?
Yeah, so compliance continues to be like one of the most common preventable reasons people are hospitalized in this country, right? There's so much data to back up the fact that people that come back to the hospital for preventable reasons, medication non-compliance continues to be the number one reason for over, I think the study was like 12 or 13 years. Non-compliance with medication is the number one reason people continue to get hospitalized back in the hospital. It depends on the patient population. In young people, the problem tends to be just a really good lack of discipline and understanding about why compliance is so important. So in the younger population, it's more of, well, first of all, teenagers at baseline, they feel invincible. So nothing bad is going to happen to them regardless of how reckless they are. And so if you put the responsibility of medication compliance within that backdrop, it would make sense why they are such a challenging population to help when it comes to helping them understand the importance of compliance and why they need to be compliant, and that you will pay for non-compliance in a few years. Not today, but in a few years, you're going to face the consequences of choosing not to take care of yourself or not to prioritize. And then there are the middle-aged patient populations, and for them, compliance non-compliance is most closely linked to a busy lifestyle and not having a systematic approach to staying organized around medications. So if the majority of your medications are once a day, my recommendation is always your once-a-day drugs, take them in the morning and be done, right? So if you're lucky and you're on a few medications and 4 out of 5 meds are once-a-day medications and none of them make you drowsy or slouchy or exhausted throughout the day, make them morning meds and have that be the first thing you do in the morning. But having an established routine, what is your routine in the morning? Brush your teeth, take a shower, get dressed for work, grab lunchbox, take meds, but incorporating actually taking your medication into your morning routine instead of treating it like, okay, if I'm not running late, I need to take my meds. Or after I have my lunchbox and everything together, then I'm gonna go take my meds. But making I need to take my meds somewhere in the middle of that process so that when you're going through your little mental checklist, you know that, okay, after I get dressed, it's my meds, and then I'll go get the lunchbox ready. Elderly patients, unfortunately, number one reason is cost. They get Medicare supplemental. Not all of them are able to afford Part D coverage. And as they age, they're on highly specialized medication. Their copays are hundreds and hundreds of dollars. They fall in the donut hole where they're responsible for almost 100% of their drugs for about 4 or 5 months out of the year. So the fall, like between August and December, we see a lot of patients come back in the hospital that are on blood thinners and a whole bunch of other specialized medication. And it's because they've fallen into the donut hole. So compliance as a whole, and it's just about getting organized and working on everybody's understanding that medications do not work if we don't take them. It's like, it just doesn't work. It only works if you take it, but if you don't take it, it's not going to work. So getting people to understand that part and educating everybody on the side effects of their medication has been the only tool where data has actually supported that it's able to boost compliance, right? The idea there being, if you tell somebody, if you take this medication, it could cause you to have blur vision. When they start to have blur vision, rather than being freaked out by it, they have already been mentally prepared to expect to have the blur vision. And they are more likely to actually stay with it, especially if you've told them that the blur vision and the fatigue or the sleepiness and all of this, it's going to pass. This is just your body's way of recalibrating to a new normal of blood pressure. That's why the blood pressure medicine makes you tired in the first 3 weeks of it. And so education is a big part of how we can help with compliance, but systematic approach to medications and when you take your medication. And we give out free pill boxes. I felt, like one of my old patients having to use a pill box right after transplant. It's just too many meds for me, even as a pharmacist, to think that I can sit there and check them off and stay organized and stay on track. And I just came to the realization, like, I need a pill box. And now I'm addicted. It's a thing, like Sunday nights are my pill box nights, right? So I fill it up, and the entire week, I just grab my tray, and I always keep a backup supply of all the meds in little bottles in my drawer in my office. In the event that I'm running late and I forget to grab the medication on my way out, I'm not going to have any anxiety because I know that I have backup medications at work in my drawer. So it's having a plan and having a system and an accountability buddy. Like that for me is my husband. Like he has an alarm, I have an alarm, and we check in to make sure that we responded to the alarm to take my meds every day. So it helps in that sense because I can share what I'm doing with my patients. But the only thing that has data behind it is that letting people know that a medication, you could get a rash or it could cause your ankles to swell. When that actually starts happening to people, instead of being freaked out and then saying, I don't want that, I don't like the way it makes me feel, you've already mentally prepared them that they can expect it those people tend to stick with it and do a lot better in the long term than the people who get surprised by their side effects.
Wow, that is so good. And I have my standing day on Saturday nights where I'm filling my tray for the week and then just picking up each day as I go. So you hit the nail on the head. Education and organization will take you much further in your transplant journey than just haphazardly grabbing things when you know, and kind of scrounging around throughout the week, because 9 times out of 10, it's not gonna work. So thank you so much. That was great.
You're welcome.
A lot of people don't think about the backup pills. I used to keep mine in the car, especially when I had to deal with my phosphorus. I used to leave those in the car just in case I happen to have to go out to eat somebody's celebratory dinner or something like that, where I know I can get in the car. Hey, I'll be back. I'm gonna go take these pills real quick and I'll come back. You know, make sure I get those done. Because of course you don't want to be in somebody's face taking medication. You know, that just kind of looks embarrassing, even though you know it's for your health. You know, so that was my thing. I just keep them in the car. But my next question is for Mr. Smith. It's the last question for you, sir. How many pounds a week should a person lose to stay safe? I guess more or less to stay out of that obese area.
I think a safe range is about around 1 to 2 pounds. I wouldn't go past that because it's not realistic as far as healthy weight loss. And that, you know, that varies because different people have different types of metabolisms. But if you're losing around that, I would say you're in a good track, and that would come with a good diet as well. And you can also do that with upping the activity that you do. Like I was saying with cardio and things, just getting more active than you usually be. And then also just maintaining a good diet and staying consistent with it. That I would say about around 1 to 2 pounds a week.
Hey, James, also, you know, I hear people all the time, I lost 10 pounds in a week. And just like, we laugh because you hear that too. And I tell people that's really not healthy, because that's when you start losing muscle. And sometimes it could be just water, you know, and you get that rebound effect. Go ahead and elaborate on that. So.
Okay, so this is actually something I learned through bodybuilding, but I also learned as being a personal trainer that people, oh yeah, you know, I dropped 10, 15 pounds in the last 2 weeks. I'm just like, oh, in my head, I'm like, it'll be back. But, and then I'm, you know, oh, good job. But let's try to make sure we might bump up the protein or whatever it might be, so we're not losing that muscle. And it's weird. I tell you, the first time I ever tried a real diet, I didn't know what I was doing, right? I wasn't with anybody, so I didn't know exactly what I'm doing. I'm thinking it's just, okay, maybe I just start eating less and maybe I starve myself a little bit. And that's not the way to go. One thing that people dear to me told me, they're like, if you want to lose weight, you got to go in a calorie deficit. You definitely got to do that. You got to up your protein. For me specifically, because I'm bodybuilding and things, and I want to keep the muscle. I didn't just, you know, lose the weight to look, you know, skinny and not look presentable on stage. But I also tell people all the time, you know, it's important to eat when you're losing weight. You think that not eating would make you lose weight, but it also just makes your quality of life not as healthy. And I try to preach this to people, and they're like, well, I'll just starve myself a couple meals. I'll be fine. I'll do a little bit of cardio. And I'm just like, well, you're not gonna have the energy to do the cardio, you know? And then I hear a lot of people always talk about, oh, well, I'll just drop the carbs completely. No carbs for me anymore. And don't get me wrong, I know there are people who are firm believers in keto diets. Me specifically, I'm not a fan of it. I would let Tiffany speak more on that. You need carbs for energy.
You're muted, Mr. Cook.
Oh, say it again. Say it again tomorrow.
I'm sorry. I said, you know, when you stop eating those carbs, and all of a sudden you start eating a little bit, your body's gonna hoard them. Like, okay, I got these, and it won't not release them. So I used to see people do that too, and I'd be like, you just don't know. You know, you got to eat. You know, because you know this as well as I do. When you lose, you want to lose the fat and maintain your muscle, because your muscle is going to help you with your metabolism, keep it going faster, because the metabolism is your engine. You know, so. Go ahead. I'm sorry.
Wow, that's good advice. And I've heard people too on diets. I got to lose 10 pounds by next week. And it's like, okay, that's not very realistic, but okay. And then you gain it right back. So it's just about, doing what you can stay consistent with and taking those baby steps. It's a journey, and so I can definitely relate to that. So we're here at our final question. And this has been great with everyone. I feel like we're right on time, close to the time at least. And so our last question is for Dr. Drake. How many times do you recommend that someone goes to see a dentist and why?
You want to do at least twice a year for most healthy mouths or cases of gingivitis. Usually they'll recommend twice a year. If you have a periodontitis, you'll probably see them at least 3 to 4 times a year for your cleanings. And then obviously if you need dental work, then you're going to come in between for that. One of the things that I would say, I know a lot of people are afraid to go to the dentist. They hear it almost every day. But the issue is delaying it or avoiding it is only making your situation worse, because what was once a small cavity ended up turning into a root canal that ended up turning into lost tooth or, whatever. And so you're really costing yourself a lot of money because you are, the treatment is more expensive now. And so a lot of times if you were to have gone for some of the cavities when they're first starting out, we can catch those. And if they're small enough, we can give you a fluoride treatment that will arrest the cavity so it's not growing anymore and you won't need to get any treatment. That's for the really small cavities. But then obviously the more advanced the treatment, the more expensive it's going to be. And then in addition to that, when you're coming in for your cleanings, most dentists, hopefully all dentists, are doing oral cancer screenings every 6 months. I know that's something that I do whenever I do my exams, and just checking for any signs, any pathology, and not just oral cancer. There's different health conditions and health diseases that manifest in the mouth, from HPV, HIV, hepatitis, lupus, all these different things. And then if something looks weird, we can biopsy, and something that you may not know you had, we'll refer you to your doctor and you can get treated for that. So it's just a lot of different things that you can do. But really it's very important in maintaining your oral health that you're coming, and not avoiding it, because it's saving you money and it's saving your teeth. So,
Dr. Drake,
I have one question. Oh, go ahead. You fine.
Yeah, so Dr. Drake, you know how when we, I'm not sure if you were, but with transplant recipients, before we go to the dentist, we have to take pre-meds. So what's your knowledge on that? Because I always feel it's just so much antibiotic taken at one time. So what's your thought on that?
Yeah, so for patients that have transplants, or sometimes if you have a new hip replacement or joint replacement, things like that, you take antibiotics because your mouth has bacteria. And so whether it's just like, and it's connected to your body. So if we're doing dental treatment and your plaque is harboring bacteria, your decay has bacteria. So all that is, you're introducing it to your mouth, or introducing it to your body systemically. And so you want to avoid, any complications, any infection. And that reminds me of another point, is like, even if there's been cases where somebody can have an infection in their mouth and that gone untreated, you can spread to your brain, and it can cause loss of life. So it's really the bacteria in your mouth. So just trying to protect those organs, and yeah.
And so what's a good amount of milligrams? I can't remember. I don't know if I take like 4 pills of 500, I can't remember, but is that normal?
Yeah, amoxicillin is going to be 2 grams. So 4 500 milligram tablets an hour before. Yeah, that's the standard for people who don't have allergies. Yeah, it is a lot, but yeah, it's just to protect you guys. And yeah, so.
Okay, thank you.
You're welcome.
So my question is this, because at the end of the day, we do help kids. So the number that you gave as in how many times a year we go to see a dentist, are those the same time as well for youth?
Yeah, so twice a year is going to be for most youth, unless they have really bad hygiene or in special cases, you know, the hygienist may recommend, hey, you've been coming in, but you haven't been maintaining your teeth, your health well at home. So I want to see you more. So 2 visits is the minimum. And like I said, that's obviously not including if they have cavities, things like that, because you're going to you may see me quite a bit if you need a lot of work. The key is to stay in the hygienist chair and not to come into my chair. So that's it.
Thank you. Well, I appreciate all the information from our panelists. Ms. Rouse, I appreciate you bringing on with us. If you can, just take a quick minute. If you have any, social media or a website that people can go to find out where you are, if you have any resources, please let them know.
I'm sorry, were you saying that for me or just in general?
No, I was saying for the panelists, you as well.
Oh, okay.
They can put them in the chat also. They can put them in the chat.
Yeah.
Well,
So
the people won't be able to see it in the chat because they're,
Okay.
most of the people are watching, Facebook or YouTube or whatever. So yeah, they won't see them,
okay, so our panelists, do you want to go ahead and share how we can stay connected? Ms. Archibald, do you want to start with where our guests can find you?
Yes, so I have a Instagram. Everything for my nonprofit is Community Kidney Care. I know it's hella long, but Community Kidney Care, excuse me. It's Community Kidney Care. And then personally, if you guys want to connect with me, it's Wellness Workout. So.
Ms. Trayor?
Yeah, so I am also on Instagram through my nonprofit, and it's Sally's Journey on Instagram as well as Facebook. And I'd love to connect and stay in touch and participate, all the above. Thank you again for inviting me to be a part of this.
Mr. Smith, I think he left. He had to go, but he
he
left
his Instagram. It's at J_Smith. So he did leave that in the comments for us to give the people.
Okay.
It's on Instagram.
Yes, at J_Smith and then lowercase I. So the third, but just the lowercase letters. And then Dr. Drake?
I had to look it up because I'm old. You can, I guess, on Instagram, Christy, so CHRISTI_KKAYDDS, and that's on Instagram. Yeah, you could do that. Facebook's more but personal, but yeah.
And then if you would like to follow my nonprofit, it's Kindness for Kidneys. And so Kindness, KINDESS, and then FOR, and then Kidneys, KIDNEYS. And thank you all again for the wonderful opportunity. I've learned so much this evening. So why not? I really applaud you all for all that you're doing to impact the community. It is making a difference.
Thank you, everybody. Mr. Cook, take it away.
Yeah. Thank you, everybody. Thank you for all the panelists. Great information, nutritionists, my little nephew, James, personal trainer, my sis, Christiane Drake, Sally, hey, and Sharon, you did your thing. Erica did her thing earlier. We appreciate everybody. Great information. It was wonderful, wonderful day. Edward, any last words before we out?
No, absolutely. Thank you, Dr. Tafaro. And first and foremost, each panelist, give yourself a round of applause or pat on the back or give yourself a hug, whatever you do. You know, like I said, this was incredible. I was blown away. I'm tired, but I still, but all this information, had me, I'm juiced. I'm ready to go get a workout in. No, I'm just playing. But y'all did a great job, seriously. And it would not be possible without you all. I would like to thank the discussion leader, Miss Sharon. She took time out of her own busy schedule, her own organization to come show us some love. Like I said, that means a lot. Like I said, we're no big corporate organization, but like I said, but we impacted a lot of lives because we come together. It takes a village to raise a child, and why not as many of our child, and we just come together with amazing people like that, and and sprinkle a little bit of God in, and you do amazing things. So once again, thank you. I want to thank my brothers. Like I said, I know they say be professional, but once again, I just thank God. So I want to thank my brothers, Mr. Tafaro Cook and Mr. Philip Jones, for putting this thing together. I just experienced some losses of some loved ones, but they was holding me down when I was traveling, laying my brother to rest. So I want to thank them for taking the initiative to put this all together and keep me inspired and encouraged. And lastly, to the audience, were you not entertained? Were you not educated? And were you not inspired? In the words of the Sean S. Carter, if I said it right, were you not entertained? And the best part about it, this is only day one. So, tune in tomorrow, 6 p.m. Eastern Standard Time, 3 p.m. Pacific. We got the same, in addition to some special surprises. So you all have a blessed night. Thanks everyone who tuned in, and definitely we'll see you tomorrow. Why not have a great night?
Thank you, Lily. Thank you, Lily. Thank you, Lily.
Yeah, thank you, Lily. Yeah. Give Lily. Absolutely. She behind the scenes.
We need you to pop up on the screen, please, so we can show the people why all this moves the way it does.
Yeah, Lily put it down, man. She always does. We appreciate you.
See, there she goes.
This is the wonderful Lily. There she is. Thank you so much, Lily. We appreciate it.
So thank you. But you all have a blessed night, and we'll see you tomorrow. Take care.
Thank you. Good night, everyone.
Thank you.
Bye.
We good? Great job. All right, we're still recording.